to cause across our city and our country. We know that building true safe communities demand long-term investments in our neighborhoods and incredible messengers in coordination with public health-based systematic strategies. CMS was created with that vision in mind. Since its launch in 2012, it has grown into a network of more than 20 community-based providers across 41 service areas, working to interrupt cycles of violence and connect individuals to services that promote stability and safety. Though these organizations operate on the front lines, deploy credible messengers, people who live in the community they serve, and who often have firsthand experience with the with the justice system or violence. Their lived experience, coupled with targeted programming, allows CMS providers to build trust, mediate conflict, and connect young people and adults alike to jobs, counseling, mental health, educational supports, and other services that promote long-term stability. Today's hearing also arrives at a pivotal point in the structure and future of CMS. In 2022, Adams' administration shifted oversight of CMS from the Mayor's Office of Criminal Justice to the Department of Youth and Community Development. The stated goal was to align CMS and DYCD expertise in youth development and community engagement. The transition was prompt a number of important questions from both providers and advocates. It is clear and consistent coordination between agencies. Are providers receiving timely payments, technical assistance, and support they need to sustain and scale their work? Has the shift led to measurable improvements or challenges in how program is administered, how data is collected and shared, and how outcomes are evaluated? And perhaps most importantly, are communities seeing the importance and impact of those changes on the ground? This work is powerful, but it's not easy. It is trauma-informed, relationship-driven, and for many staff, it is personal. Interrupting violence is not a 9-to-5 job. It's work that continues late into the hours, on weekends, and during the moments of crisis. I'm really curious also to see how the task force, the gun violence task force, is driving the policies and data that is needed to push this work forward. Ultimately, our goal is to ensure that CMS continues to be a national model for how crisis and cities can invest in public safety through prevention and not just punishment. This means providing the necessary funding, training, and oversight to support organizing doing the work on the ground and preventing cycles of violence. We also hope to engage in a constructive dialogue with the administration today about how the bills interact with ongoing agencies' work and what steps can be taken to move them forward. I'd like to thank staff for their hard work in preparing for this hearing. Senior Policy Analyst Elizabeth Arts, Committee Counsel Christine, why do you take your last name out? Yamamati, did I say it wrong? I said it right. As well as my team back in District 16. Now I would like to take the time to allow some of my colleagues to give brief opening statements. I will start with Councilmember Lee.
Thank you so much, Chair. Good afternoon, Chair, colleagues, and members of the public. Thank you for the opportunity to speak on Intro 1259. This legislation was actually directly inspired by what we learned in roundtable meetings that we had with youth-serving community-based organizations. And staff on the front lines really did express the desire for more training to be able to support justice-involved youth in ways that are trauma-informed, developmentally appropriate, and effective. Intro 1259 responds to that need by requiring foundational behavioral training for all direct service staff in juvenile detention facilities who do not hold clinical or behavioral health licenses. This training would cover key principles of behavioral support, positive reinforcement, de-escalation strategies, and culturally responsive care. And the bill also makes this training available to our community-based organizations working with system-involved youth. And that means the same tools and best practices can be accessed by the very providers who often serve as the bridge between youth and their communities. So it is very important that we would like to extend this also to CBOs as they are essential to this work. It's a bill about capacity, it's about care, and it's about equipping every adult in the ecosystem from ACS facilities to grassroots nonprofits with the tools to support youth with skill and compassion. So I just want to thank the committee for hearing this bill today and look forward to hopefully passing it. Thank you.
I would like to also acknowledge Councilmember Menon, Williams, and Councilmember Joseph. Pass it to you for your opening statement.
Thank you, Chair. Good afternoon, Councilmember Stevens and colleagues of the Committee on Children and Youth. Today, I'm proud that you're holding a hearing on my bill, Intro 1077, which introduced alongside co-prime sponsors, Councilmember Brewer, Osei, and Riley. This bill requires New York City ACS to provide luggage for foster youth when they enter the system, move between placement, exit care, head to college, or any other reason. As a foster mom of two, I've seen firsthand how painful and humiliating it is for children to carry their belongings in trash bags. This is simply unacceptable. Intro 1077 will make sure New York City does better. States like Oregon, Texas, and Maryland has already addressed this issue. It's time for New York to follow their lead. We are proud that this bill will make that happen. Chair Stevens, with your permission, I'd like to share a few testimonies from foster youth that my office received, share them when the bill was first introduced, and felt compelled to share them again today. I didn't feel like I mattered. It seemed like they were rushing me more important than treating me with dignity. The least they could do is give us proper luggage. This was from a 23-year-old foster youth. When I was moved from group home to group home, my stuff was packed in garbage bags. Sometimes my things got mixed up with trash and thrown out. My belongings weren't treated as important. They picked what they felt like carrying and threw out the rest. Traveling with trash bags became my new normal. It's heartbreaking to hear these stories from these young people we have pledged to protect and support. I know this council is committed to correcting past wrongs. Passing this bill is one step we can take to ensure that no child in foster care ever have to carry a black trash bag again. Thank you for your support and partnership in helping get this bill across the finish line, and for showing our foster youth and children that we value their dignity. We have worked with several organizations, spoken to press, launched campaigns to spread the message loud and clear: foster children and youth matter. Special thanks to Sophie and the entire team at the Next 100 for their help in drafting this bill, and our youth advisories at Fair Futures, to the staff at Hart Share and St. Vincent for joining us at City Hall when we introduced the bill, to my staff for their dedication, to the bill drafters for their collaboration, and to my co-prime sponsors for their continued support. Thank you, Chair Stevens.
At this time, I'll pass it over to the committee staff to swear in the administration.
Hi, please raise your right hand. Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee, and to respond honestly to council member questions? Michael Williams? Jessica Reithel? Denise Williams? Dr. Clifford La Rochelle? Dr. Karina Christensen? Thank you. You can begin when ready.
How do we turn this on? Good afternoon, Chair Stevens and members of the Children and Youth Committee. My name is Denise Williams, and I serve as Deputy Commissioner for Planning, Program Integration, and Evaluation at the New York City Department of Youth and Community Development. Today, I am joined by my colleague, Jessica Reithel, who serves as Assistant Commissioner in the same bureau, Dr. Cliff La Rochelle, Executive Director of the Office of Neighborhood Safety, and Dr. Karina Christensen, Deputy Executive Director of the Office of Neighborhood Safety. And we are pleased to be here to discuss the crisis management system. As you know, CMS has a long-standing history in New York City and has continuously evolved over time to best meet the needs of our communities. The Cure Violence model was originally brought to New York in 2010 and funded through state and federal funding, thanks to the advocacy and expertise of many of the community-based organizations who still run programs today. Back then, all the organizations decided to adopt the ceasefire model out of Chicago, which later transformed into Cure Violence and then again evolved into CMS, or the Crisis Management System, that supports many neighborhoods across the city. Cure Violence was originally designed as an intervention program to engage those individuals who are driving violence in their communities. Cure Violence is a specific public health intervention that views gun violence as contagious disease, where a very small number of individuals drive the outbreaks. To address the problem, trusted, credible messengers seek out those individuals and persuade them to change their behavior. To maintain the credibility of CREASE staff who are influential because they have similar backgrounds to those who drive the violence, including histories of criminal behavior and incarcerations, the programs operate independently from law enforcement. Cure Violence uses three major strategies. Strategy 1, interrupt and de-escalate incidents of gun violence to stop cycles of retaliation. Number 2, connect the people who are driving violence to services that help steer them away from violence. And number 3, change community norms by engaging residents in collaborative efforts to promote public safety. Although challenges are abundant in assessing the impact of a program that is intertwined with so many community and individual factors, over the years, evidence points to a positive impact on community safety and public perception for high-fidelity programs. To further enhance this model, New York City has gone a step further to embed the Cure Violence model in individual, specifically designed support services that also act as prevention. This led to the development of CMS, or the Crisis Management System, which includes a spectrum of wraparound services to complement and expand support to individuals and communities. These include community healing and wellness programs, youth enrichment services, including mediation in schools, professional mental health services, and mobile trauma units. The vision was further realized when DYCD stepped in to provide support and assume responsibility of the CMS programs. The move allowed for more intentional integration into DYCD's network of services, which can address a broader spectrum of needs, including workforce programs, community-based case management, and community centers. Since assuming responsibility for ONS in 2023, DYCD has conducted a comprehensive assessment of CMS programs and outlined priorities to ensure a successful onboarding. These included documenting fidelity to the Cure Violence model, strengthening connections to other DYCD-funded programs, increasing capacity building for community-based organizations implementing CMS programs, structuring and launching a data reporting system for all programs, improving contracting and payment structures, and establishing a commitment to continuous quality improvement, both internally and externally. Studies on the state of evaluation for Cure Violence programs have emphasized the importance of implementing the model with fidelity to be able to replicate findings and point to essential program components. To this end, DYCD has integrated CMS programs into our agency-wide evaluation and monitoring system, which tracks essential, contractual, and model requirements. CMS programs now receive standardized site visits from initiative managers to document adherence to requirements and provide coaching and additional resources where necessary. Thus far in FY25, 102 evaluations have been conducted by ONS staff, and 98% of those evaluations received a meet standards or above, ratings of meet standards or above. Another key component of the model is to monitor violence and incidents through community intelligence, live and historic data. To this end, DYCD has integrated NYPD data streams into its system of record to support real-time, data-driven communication between ONS initiative managers and CMS providers. As opportunities to explore expansion has arisen, DYCD has actively analyzed shooting data to inform catchment areas and potential changes to the model. DYCD also regularly convenes with NYPD to understand data trends and public safety needs to inform provider efforts while still maintaining independence from law enforcement. The data DYCD receives is shared with CMS providers to ensure that interventions are targeted, timely, and community informed, and this process is operationalized through localized planning meetings, provider strategy sessions, and coordinated response efforts. DYCD has also committed to expanding access to other DYCD programs to CMS participants and has been intentionally hosting networking and informational sharing convenings with CMS providers and other providers in the DYCD network. Additionally, DYCD is building specific pathways to collaborations and referrals through initiatives like our CRED workforce program and the Summer Safety Plan involving our community centers. DYCD has also reimagined the specific CMS wraparound services by aligning scopes to program goals and needed staffing, such as through consolidation of YES programs, and has rolled out new professional mental health supports based on the needs on the ground. DYCD has a robust technical assistance and professional development network of support for community-based organizations it funds and has prioritized CMS, NCV, and the CV providers within the network for these supports. To introduce these resources, particularly in the area of financial management, a recognized need among these cadre of organizations, DYCD staff and TA providers have conducted intentional outreach to CMS providers based on their identified needs, adding an on-site introductory meeting to the normal handoff to the consulting group. One particular engagement with a financial management firm and a CV provider focused on entering and reconciling 2024 transactions in QuickBooks to ensure the accounting system accurately reflects all activity for the year. The consulting group also compiled the necessary backup documentation for expenses to allow the CBO to invoice under their DYCD contract from July 2024 through March 2025. A highlight of our commitment to the professional development of frontline staff was through our Family Development Credential Program, often referred to as FDC. During spring 2024, 15 credible messengers completed the FDC program and are eligible to earn 9 college credits. DYCD also provides specific support and training for CMS providers to onboard into DYCD Connect, DYCD's data system of record. Thus far, in FY25, 9 data system trainings were held specifically for CMS providers. Finally, model-specific support is provided by the nationally recognized Cure Violence Global. This brings us to the development and launch of DYCD's data reporting system in DYCD Connect, our agency-wide system of record. As we onboarded the programs into our agencies, we assessed not only their scopes, but also their data collection needs. The result was the need to further clarify metrics through contractual scopes and to develop a system that protected participant confidentiality and safety, while still ensuring that we can assess the program's activities and measure its reach in the community. The metrics we collect are aligned with the CV model and include measurement of the 3 main components of the model: violence interruption through de-escalations, long-term mediations, and shooting responses. Through the first 3 quarters of FY25, Cure Violence programs have conducted 5,217 mediations, 6,458 de-escalations, and 189 shooting responses. Participant connections to services through caseload and contact tracking and referrals is the second component that we track. During the first 3 quarters of FY25, Cure Violence programs averaged a caseload of 1,363 participants over the course of a month and had a total of 43,271 in-person contacts with participants and 31,418 virtual contacts, with 4,987 referrals to services, including job training, education, and counseling. Lastly, community engagement through community events and broader community member interaction. DYCD currently collects metrics aligned to these and is working to provide further quality assurance to ensure they fully represent the work on the ground. DYCD also tracks demographics of participants and staffing levels at programs. Moving into FY26, CMS wraparounds will also report data using DYCD Connect, each with its own customized build-out based on the goals and structure of the program. DYCD is also committed to continuing to improve data collection and clarity of the metrics it collects. To this end, the agency has launched a data work group that is a collaboration with CMS providers, DOHMH, and DYCD to collectively recommend standard language for key metrics and to ensure understanding of the entire network. DYCD remains committed to continuous quality improvement across all aspects of the programming and has partnered with the National Opinion Research Center, NORC, at the University of Chicago and John Jay Research and Evaluation teams to conduct a long-term study of the program's implementation on the ground. The evaluation launched in FY25 and has 3 aims: review current services, data utilization and quality, conduct a process assessment of the CV model, and assess the ONS transition to DYCD. This is being implemented through a review of program data, site visits to CMS provider sites, and interviews or focus groups with CMS providers. This study will be the foundation for further long-term outcome and impact assessment, as well as a tool for DYCD to further improve programming, inform future program models, and RFPs. As I've mentioned, the foundation of any solid outcome assessment is an implementation assessment, and DYCD is committed to doing the work to ensure the foundation is solid. DYCD has also built-in feedback loops with providers on an ongoing basis through full network provider meetings, a steering committee of key provider leadership, and close contact between initiative managers at ONS and providers on the ground. This allows for ongoing adjustment and the ability of DYCD to be responsive to emerging needs and concerns. As mentioned earlier in the testimony, since assuming responsibility for ONS in 2023, DYCD transferred all contracts from MOCJ effective July 1st, 2024, and took over both the contracting and payment processes with CMS providers. In FY25, CMS providers transitioned from subcontracts to direct contracts with DYCD, allowing for greater transparency, support, and accountability. DYCD provides the CMS network access to one-on-one budgeting and invoice support, which will continue to be available all next year. All CMS contracts are registered and active heading into FY26, and per the administration's recent commitments on additional advances, providers will receive an advance of 50% of their registered FY26 budget. Additionally, providers have been trained, and we continue to actively engage them to ensure budgets and invoices are submitted and approved in a timely manner. In terms of Intro 992, we support the intent of the bill, but have concerns such as disclosing why a contract was not renewed. We look forward to negotiations with the council post-hearing. Finally, we appreciate the council's strong support of DYCD and the CMS provider network, and thank you once again for this opportunity to testify today. We are pleased to answer your questions.
Okay. Thank you. I guess I'll jump right into it. So one of the things I'm always asking about is how we're evaluating and what data we're collecting. And so the controllers report in 2025 analyzed the CMS programs, found that the city lacks a standard approach to data collection across the providers. What specific metrics are CMS providers currently required to report, and what systems are in place to uploading and submitting that data? I know you talked about DYCD Connect, But I know that system was not originally meant for this. That was a system that you guys are now integrating into it. So I would love to know, like, what other systems are you using to collect this data?
Thank you for the question, Chair Stevens. So yes, as we mentioned, DYCD has spent the last year onboarding CMS into DYCD system of record, DYCD Connect. DYCD Connect is a DYCD developed system which allows us to customize the metrics collected for each program scope and have the flexibility to meet the unique needs of each program. So the metrics that providers are required to report are aligned with key program requirements. So for cure violence, the metrics are aligned with the 3 areas of the program, such as de-escalations, mediation, shooting responses, caseload, participant contacts, referrals, community events, and community members engaged. On the other hand, for others in the CMS network, the development has been more specific. So for MTU, for example, the mobile trauma units, the programs collect metrics specific to their deployments. For youth enrichment programs, they track metrics specific to peer mediation, workshops, safe passage work in schools, et cetera, et cetera. So each CMS program has a build that is really specific and geared toward their program scope and goals.
You said a lot there, and you were reading really fast, so I have actually a lot of responses to that. So, but I'm gonna go to the next question because, like, one of the things I know when we were in the very beginnings and we were looking into getting the contracts when they were under MOCJ is even around the shooting response. What are we trying to get there, and what are we trying to solve with that? Because I've always had an issue with shooting response because the shooting has already happened. Often they're in the middle of the day, and how is that effective use of time for the CMS groups when, speaking to a lot of them, they're already stretched so thin, and how are we making sure that we're using the best use of their time when we're thinking about these metrics that we're coming up with?
Yeah, thank you so much for the question, Chair Stevens. So shooting responses are part of the public health approach to violence, right? It's a community response to a shooting that happens in the catchment area. And
I know what it is, so you don't have to tell me what it is,
Right.
because I'm very aware of it is, and we all have a lot of time. I'm asking, how is that the best use of the time, especially when we know these CMN groups are stretched so thin, and a lot of times it's them trying to organize and get people there when they can actually be out there mediating and doing some other things. And it doesn't seem like a good use of time, and it often feels like poverty pimping, because at that time we'll get every news camera to come out to see that and look at the pain of our community, and opposed to them being more useful with their time. So I would just love to understand and get a deeper understanding of how is that effectively a good use of the time, because we know what happened.
Right. And so what the goal, and I'll just be very quick, with a shooting response is to put messages of nonviolence before the community. So a shooting happens and the community coalesces, comes together and says, hey, we're not going to allow this to overtake our community. We're not going to allow community violence to overtake our community. And so that's the broad goal of the shooting
I just want us to
responses.
start thinking about if that is actually effective, because I know you guys listed it as you had 189 shooter responses, and so if we have 189 of them, clearly they're not working. And so I think that's a place where we need to be looking to make sure, is this working and is it effective? Because if we're collecting the data, it's showing that they're still happening and it's consistent. But I also just think, especially with the CMS groups being stretched so thin, and having sometimes I heard where their crisis management and violent interrupters, this may be a group of 8 of them. I don't think that that's the best use of their time to stand out and tell people not to be violent in the community when they're doing that on an individual basis already. My next question is, providers have noted inconsistencies in what different organizations track. What steps in your agency is taking to standardize the data collection and reporting across all of the CMS providers?
Thank you for the question, Chair Stevens. Some CMS providers, like other DYCD-funded program areas, may use other proprietary systems, and so they collect their own metrics as well. However, DYCD does require data entry in our agency-wide system, DYCD Connect, to ensure...
So if they are collecting data in the other systems, are you guys also working with them to see why they're collecting that data? So that, because again, I know you guys have only had this for a year, and it lived in multiple places. And so, I don't want us to have a program that's coming to DYCD and you're trying to make it fit your system and not the other way around, because that wouldn't make sense. And so if they're collecting data in other places and that's why it's inconsistencies, have you guys looked opposed to it being like, okay, well, DYC Connect is what we have and this is what makes sense?
Yes, so there's a few approaches we're taking here. So one is we recently launched a data work group to really look into like definitions, what are people collecting, what's happening on the ground, make sure we're all aligned across the whole network. We are also in our implementation assessment that we're doing with the University of Chicago and John Jay. One of the things that we specifically wanted to focus on was speaking to the folks who were managing the data in these programs to understand like what is their process, are there improvements, are there challenges, and how can we address that? Because as you said, this is they have launched just this past fiscal year, and so, or this current fiscal year, I guess, and so we have some learning to do, and we're committed to continuing to improve.
So I hear that you guys are working on like trying to figure out the data system, but how are you working with providers? Because a lot of them express interest in technical support to improve their data collection and their capacity. Is there funding available to kind of help and support these groups with supporting them and supporting upgrading their systems and forms and technical support? Is there money around that to support them with funding?
So thank you for the question on that. So DYCD has been providing training on its data system, so DYCD Connect, to onboard into that. We do have a vendor who's specific to that. DYCD or ONS initiative managers also support providers in ingesting data, understanding how to use it on the ground. And the providers also have access to DYCD's whole suite of capacity building and technical assistance services. And so we do have a vendor, for example, who specializes in developing outcomes, making sure things are aligned to a theory of change, and really working with providers on the ground. And again, as I mentioned, our research partners are really specifically planning to speak with the data coordinators, and we look forward to really understanding the needs on the ground and making sure we're able to address those.
So your data coordinators are folks who are working in-house with you guys to figure out like the data systems. Is that correct?
So there are folks who are, and y'all can speak to, maybe more on the ground. So there are folks who are working in the programs and the providers who are responsible for doing
No, I understand.
Okay.
So when I'm asking like the data that's being driven, is that mostly in-house? How are you getting the feedback and working with the providers? Because I think some of my issue is like this program has like, it really expanded a lot and expanded very quickly. And so my question is around what supports are we giving the providers to be able to keep up with the pace of it? So yes, understanding that, I'm asking, do you have people that's supporting them on that data piece to help with this expansion the way it has?
Yes, the ONS initiative managers are their key contacts on the ground, and so they're providing the coaching both in terms of the program implementation, but also in terms of the data, and they bring back anything, any issues that happen with data systems, any type of support they need. They either bring it back to our bureau, which houses our analytics and evaluation teams, or our information technology teams to make sure the systems are aligned with what they need.
While CMS providers currently report on some key metrics, others have some long-term outcomes such as number of conflict successfully mediated over time, participant retention, reduction in recidivism. Those things are not tracked. Do you plan on expanding the scope and requirements of metrics to better evaluate the impact of CMS?
So thank you for the question. We're always
You don't have to thank me. It's fine. You could just answer the question. We family now.
Grateful for the
We're in
opportunity
the conversation.
to speak to it. So we're always striving to improve data collection and build out our knowledge of the program. So we currently do have an evaluation contract with the University of Chicago and John Jay to really do more specific implementation assessment. And so, we really are trying to lay a foundation here, right? So we have the data that we're collecting through our system of record. We have that data collection that they're doing on the ground. They're really going out to providers, doing site visits to understand. And we really are using this as a foundation to really get to those longer term outcomes. So we look forward to really defining those, understanding how we want to do that tracking in the long term, and to build out our data collection for longer term kind of participant outcomes in a way that really protects confidentiality and safety while being able to get at some of that longer term assessment that you're asking
Honestly,
about.
I'm a little disappointed that we're not further along because it's not like this is a new program and it's been so many different iterations. And it kind of feels like now that they're done DYCD, it feels like we're starting from scratch when we shouldn't be. And I'm specifically talking about this data collection piece. I feel like we should be much further along. This is like an echo in my ear. much further along. So I'm a little bit disappointed that like we're still trying to figure out the data collection piece, because honestly, this work affects lives, and so if we're not tracking the right thing and trying to use this to drive the work, it's really unfortunate that we're still trying to figure that out, especially when some groups, it's clear that some groups are collecting it, so I don't understand like why we're not talking to them to allow them to drive what that would look like, because like it said, a lot of them, when I was meeting with these groups, they're talking about, some of them are collecting like the long-term mediation stuff that they're doing, and those things, like we're still at the very basic and lower level of collecting data, so I'm a little disappointed. Cities like Chicago and Oakland have successfully implemented data dashboards, which serve as a central two-way data sharing system for CMS providers tracking shootings, data of violence trends, public health data. Without access to this data, CMS groups have forced to operate incomplete information, relying solely on community intelligence rather than citywide data. How are CMS providers currently notified of community incidents such as shooting or potential retaliatory violence that may require an immediate response or intervention?
Yeah, thank you so much. So there are various ways in which we are able to track violent incidents. We're able to track it through street intel from our credible messengers. We're also,
but that's part of the problem, right? Because like they should not have to only get the information from there, and we should be further along. This is like, again, this was in Department of Health. This was in MOCJ. We still are at a place where our providers have to go out on the ground to just get street intel. That's some of it, but we should definitely be having a better system.
Right.
So not to interrupt you, like I'm a little disappointed, just so you know. I thought we were so much further along.
So it's not just street intel. Street intel is PD alerts that we receive on a daily basis, as well as hospital data. So we receive hospital admission
Is it
data.
in real time?
Hospital data.
Okay, I heard it. They said no.
In near real time. In near real
They
time.
said no. I heard the providers. I'm not good.
I said near real time. Yes.
Somebody already shot. That's real time. Nobody cares real time. It's not real time. It's not real time. But that's a problem for me. So that's a place that we need to really hone in on, because I think that we should be at a place where this is much further along. Has DYCD explored creating a real-time data dashboard, allowing providers to access and contribute to real-time information that improves intervention effectiveness?
So we have integrated NYPD data streams into our DYCD Connect. So we have that real-time data coming into the system, and ONS initiative managers are able to communicate that to CMS providers. So we're really using that to ensure that the
When you say you're integrating NYPD's stream, what does that mean? Explain that, please. You have to go over there to the mic so they can hear you on now. Oh, you have to get sworn in as well.
Please raise your right hand. Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee, and to respond honestly to council member questions?
I do.
Thank you.
Hi, good afternoon. I'm Denise Ramirez, Associate Commissioner for Diversity, Equity, and Inclusion. Our team also leads the mapping and data analysis for our agency. So our agency receives real-time alerts from NYPD on incidents. That data is automatically mapped and visualized in a map that shows the location of the incident, the type of the incident. There's 3 maps that are
So
produced.
everyone has access to this in real time?
The ONS initiatives managers have access to this in real time.
So
And that they're the ones who coordinate with our providers.
could you make it make sense? Because you're saying that the manager who's not in the field and who's not responding, they have access, but the people who are actually going to be out in the field and actually in the community has to get notified from them. So let's be clear. So we have the NYPD who gets notified, then the ONS folks get notified, and then the CMS people get notified.
Yes.
That don't make sense, guys. That doesn't make sense.
It does not.
Because that's overlapping a lot of time. So I think that's a place we got to clean up, because that just doesn't make sense. And it
What do they know about the communities? I'm just saying, what do they know?
they don't. I agree. So and my question is, so why can't we just have that data go straight to the ONS sites? Why? What's the lag? What's the reservation around that?
Right now, the agreement we have with NYPD is for the data alerts to come to DYCD on this.
But why is that the agreement?
It's the agreement that has been in place, Chair Stevens, and what we do is we're able to triage that data. Now, to understand something, when I mentioned
When you
that-
say triage, what does that mean? How are you triaging the data?
well, to take the data in, and we want to make sure that we're triangulating data. What I mean by that is that it's reliable, right? So we're getting data
So
from
the
NYPD.
police department isn't sending you reliable data?
Not saying that.
I'm just asking the questions. I'm asking the questions for the answers. That's all I'm doing.
Totally. But again, we have data that comes in from street intel. We have data that comes in from the PD.
But
and
I'm
we
talking
have data that
specifically,
comes
I'm
in
not
from
talking about the street intel, because you guys aren't collecting the street intel information, the providers are. So that information will be coming from them, not you. So my question is around, why will we not have the live data coming from NYPD going straight to the providers so that they can be more efficient in responding to the crises in the community on the ground?
And that's something that's that's something that we could definitely look into, Chair Stevens. Right now, as it stands, we triage the data, and then we have our borough managers and our initiatives managers triage that data and coordinate with the folks on the ground.
I don't like stuff that don't make sense, and that don't make sense to me. I don't like it. And so, was this a decision from NYPD or DYCD?
I wasn't privy to those discussions. I'm imagining that discussion happened between NYPD and DYCD.
That makes me sound like you weren't privy. You're the ED. So I want you to be privy to those discussions. No, he just said he wasn't privy to those conversations.
It has a little bit. Can I ask one of my colleagues to come up to?
Of course.
to-
It's a party.
It's a party. It's a party.
You don't have to ask permission. Just come up. You got to be sworn in. Oh, you sworn in. Okay.
So, Chair Stevens, we're in the process of actually providing a direct link between PD alerts and our CMS providers. So what we've done over the course of this year is we rolled out earlier in the year the ability to connect to really executive directors and program administrators, and we asked them to designate a supervisor, either their VI supervisor or OW supervisor, to receive the alerts. So to clarify, DYCD is in the process of moving to a system where PD alerts can come directly to providers. We've had
Y'all know
some
this is not this hard. Y'all know it's technology and all this stuff can be
But-
done really quickly. Like
Yes.
I don't know why we're making it seem like it's brain surgery and saying we have to designate. I'm almost positive all these providers are going to get up here as soon as you guys move from the dais and tell them that they've requested this information, they want this information, they have the person designated and all the things. So this is where I get frustrated at in these hearings, because there's such a disconnect from the work that you guys are doing and then what the providers are actually saying are happening. And so it should not take a year, because this has been under DYCD for a year. And let's be clear, it was under MOX for even longer. So that's why I'm even frustrated. This isn't a new program. And this is stuff that we should be evolving. And this is where my frustration comes in at. So I hope by the next time we have a hearing, you guys will be saying like, oh, all of this is done, because it doesn't take that long. I'm telling you, as soon as y'all get up, these providers are gonna say, we asked for this information. I already got text messages saying that they've asked for this information. They've emailed, and they have emails showing that they've asked for this information, and they're not getting it. So it's just very frustrating. In addition to real-time shooting, CMS providers do not have access to public health data, such as substance abuse trends, mental health crises, hospital admissions for violence-related injuries, which could allow organizations to connect at-risk individuals to appropriate services and address underlying causes of violence before they escalate. Has DYCD explored granting CMS providers access to that data?
Again, I think for us, the major thing here
They
is...
set you up. Let me tell you. You need to text them.
Well, no, I think, again, part of this...
I ain't saying he worked hard. I said they set him up.
Well, I want to say this, because I've been part of this work for a long time, so we can have straight talk.
I
right?
told you they like
so
you.
we can have
So,
straight talk.
look, they are defending you,
Right.
but they set you up, bro.
Well, listen, a lot of these data sources we don't have access to. These are not primary data sources for us. We're working in collaboration with other city agencies such as DOHMH,
But don't get me
ACS,
started. That's
New York
part of
City
the
Public
problem.
Schools.
It pisses
Right.
me off that we sit here and act like the city isn't one city. And so there's no reason why this city agency should not be getting information from this city agency when all this work is intertwined. And so this is something I've been talking about for the last 4 years. It does not make sense. And especially when this started under DOHMH. So we should already have had information coming and flowing from there because this is where it started. So I'm gonna calm down. I'm about to pass it off to Natasha, but I don't think she's gonna be nicer, just so y'all know. Another question that I have, even around some of the work, I met with the gun violence task force last week and really was looking at a lot of the stuff that they're doing. How are you guys using the task force to guide the information to continue to change policy within CMS? Because I know that they've been doing a lot of work around like policy and being in the community as well. How are we using this work to guide the work and use it as support, and what does that look like?
Yeah, definitely. So we're happy to have the task force, the Gun Violence Prevention Task Force, and a few of the things that the task force does is they help to mobilize other city agencies. To your point earlier, Chair Stevens,
They mobilize other agencies, but we don't got none of the information.
So, you know, in
I
addition
don't
to
like stuff that don't make sense.
in addition to helping to mobilize other city agencies around our public health approach to violence prevention, they also support internal analysis of our data, and also they're the ones who are coordinating our summer safety plan, which is an activation of spaces throughout the city over the summer, increasing hours that we make safe spaces available to young people.
What's going on with the expansion of that? Because I know like what precincts are they in again?
So we have 13 precincts that have been written down. We're in the 40th precinct, 42nd, the 44th, the 47th, the 73rd, 75th, the 40th, the 40th, the 44th, the 46th, the 42nd.
You're in the 46th as
73rd.
well?
Yes.
No, you're not. 'Cause that's where y'all need to expand to. I know. You know, y'all know I know the answer to the questions I'm asking.
This is a summer safety plan.
No. I asked the task force, what precincts are you guys in the task force? We didn't get to the summer safety plan, because you know I have a
I'm
whole
sorry,
list of
I was
questions for
mentioning
that.
the summer safety plan. We're in 13 precincts for the summer safety plan.
Yeah, I know
we're
that one.
activating spaces. Yep.
Yeah, no, I didn't get to the summer safety plan. I was asking still about the task force. What precincts are you guys in for the task force?
Yeah, just the first six. The 40th, 42nd, 44th, 47th, 73rd, and the 75th.
And when were those precincts decided?
I'd like to get back to you on that, but I want to say that they were divided.
I know, it's 2022.
Yeah, 2022. Yep.
What
it's
year is
part
it now?
2025.
Yeah, so why are we using old data to guide that information? How are we updating the data if that was from 2022 and it's 2025, and we know those trends have changed and shifted? Because prime example, the 4-6 is on fire, and so we're not in the 4-6 with this task force, around the gun task force, and it's been for the last 2 years. So how are we using updated data to kind of guide this work?
Yeah, and so again, you did mention those setup, but seriously, Chair Stevens, I think for us, we're always looking at the data, right? We're always looking at data because this approach to violence prevention requires us to look at the data so that informs the work that's happening on the ground. Sometimes it doesn't move as quickly as we would like, but we are looking.
But violence does, and so we have to move quickly. So I don't think that's an excuse. This work, we gonna do this because I don't want the sergeant of arms to start yelling at me, because y'all know I'm always in trouble. But violence moves, and so like we can't be using old data and not moving. Like literally, this work needs to be fluent. And so I'm a little disappointed that we have a task force that was created with really good intention. And actually, after meeting with them, I know that they're working on some stuff and looking at policy, but we're also looking at data from 2022, and it hasn't changed. And so that's another huge red flag for me, right? Because when we're talking to folks, and especially in communities, and they're like, well, what is the CMS groups are doing, and blah, 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 they're getting the backlash of it because we're not moving fast enough. And so we have to put some fire under this work. I'm gonna pause here because I know Councilmember Williams has some questions. I have a whole bunch of other questions, but she's been chiming in, so I want to give her some space. And go ahead.
Thanks, Mike.
Oh, look at that. I'm sorry. Hello. How are you doing? Our public advocate is in the building, so he actually has an opening statement, so I will let him speak. I didn't know he was.
Thank you so much. Peace and blessing, love and light to everybody. Opening a statement in the middle of the hearing. So thank you, Madam Chair. Not in the greatest mood. I just came from 26 Federal Plaza, where our comptroller is being held by federal agents. So I want to just thank him for trying to be present of the horror that's going on there. And I'm going to call on Mayor Eric Adams to step up and condemn what happened and demand his release immediately. Good afternoon. My name is Jamani Williams, as mentioned. I'm a public advocate of the City of New York. Thank you to Chair Stevens and committee members for holding this hearing. Today, the council is holding an oversight hearing about the crisis management system under DYCD. So I'd like to take a moment to discuss youth crime, an increasingly popular topic of coverage in the media. Fear-mongering among youth crime has existed for decades, with perhaps the most well-known example, the idea of the teenage super predator, contributing to a travesty of justice in our city with the wrongful conviction and incarceration of 5 teenage boys for assault and rape in Central Park, one of whom is now a member of the body. Headlines about rising youth crime blame Raise the Age, the 2018 law that raised the age of criminal responsibility from 16 to 18 years old. Arrests of people under the age of 18 have increased since 2022. Mayor Adams, the NYPD, and publications like the New York Times are quick to point to posit that gangs entice young teenagers to commit crimes because penalties are less harsh. At the same time, the data paints a more nuanced picture. Research has found arrest trend among people under age 18 generally mirror trends among adults age 18 and older. This is not to say that any young person committing a violent crime or wielding a gun is not a cause for deep concern, but we must also be truthful about what the data shows and not cherry-pick statistics. Increases in youth arrests are generally proportional to increases in arrests across other age groups. The bottom line is that if recent changes in crime were due to the implementation of Raise the Age, age-specific patterns will be observable in the data, and they're not. I just also want to mention that the youth crime across the nation has also increased. That certainly can't be blamed on New York's Raise the Age. Crisis management system recognizes that youth crime is something that can be prevented, though through non-carceral, non-punitive means. I'd like to quote DYCD Commissioner Keith Howard, "By the time a young person picks up a gun, the system has failed them." CMS, which deploys teams of credible messengers who mediate conflicts on the street and connect high-risk individuals to services that can reduce the long-term risk of violence, is an interagency collaboration between DYCD, Department of Probation, NYC schools, and health and hospitals. In 2023, Mayor Adams announced that the Office of Neighborhood Safety would shift to DYCD from MOCJ in order to integrate community violence intervention programming into the existing programs it runs. From 2010 to 2019, there was an average 40% reduction in shootings across all CMS program areas, compared to a 31% decline in shootings in the 17 highest violence precincts. In a report published by Comptroller Berlander's office in March, an analysis found that these community violence intervention programs are limited by data gaps and inconsistent leadership, as well as long and growing payment delays to program providers. In addition, I just want to mention I've co-sponsored all the pieces of legislation today. I think it will help provide a better and dignified service for youth in NYC detention centers. But I also want to mention, as someone who was the chair of the task force that helped expand this greatly, and someone who was the co-sponsor of the bill that started the gun violence task force, I have seen stagnation in this work for a very many number of reasons. I also have not seen it allowed to be structuralized so that it's a real part of the public safety discussion. I don't see any folks from CMS during press conferences. I don't know if there are any discussions about what's happening. All the public-facing discussions are usually with police and the police department. That really does not make sense if we are trying to integrate a different way of thinking about this. There are very real violence that occurs here, so I don't want to undermine people who are harmed by this. But we do know simply going forward and trying to arrest the children of the people we arrested 20 years ago, it's probably not going to have a different result than it did 20 years ago. I am infuriated because when I used to speak to Mayor Eric Adams, when he was Borough President Mayor Adams, we had much discussions of how we can do public safety differently. I know that he is a complicated person, like we all are, but I only seem to hear from the Republican cop and not the person who is the head of 100 Blacks in law enforcement. And that is very frustrating because we had the opportunity and we've wasted it. We have wasted a golden opportunity to show how we can integrate a public safety model that shows that public safety is a shared responsibility. And so when we hear these questions that we've been asking for years, probably over a decade now, and it's the same crap over and over and over again. Folks are not even getting paid. CMS people are getting shot, and they don't even know what to do after that. There was a huge disconnect, and I believe that disconnect is there is not real buy-in from the top, from the mayor. There is not real buy-in to this work that's being done. And that is why it's not integrated and why we have the problems that we do. That is a fundamental problem that we have here. There is so many issues that can be easily resolved if there was real buy-in. It's different from precinct to precinct, whether that precinct has buy-in or does not have buy-in. That is also from the top not giving the orders that should be given. There was, I believe, there was also stagnation because now, people try to figure out where they can get a contract when we should be building on the infrastructure that's there. There are so many things that we could have built across that. There's things that I had funded that were taken away, given to other agencies, and nothing was done with it. We have a golden opportunity here. I would say my hope is that the next mayor, because I don't want this mayor anymore, will actually use that opportunity to build out the thing that we know we can build out and be a real, true beacon for folks. These people doing amazing work in the streets and not even getting paid. The least we could do is integrate them. And there's an overlay now for many other programs that we could put directly on. And I'm going to be honest, it's not a panacea. It's not. But it is a thing that we know is working. I also stood with the mayor 3 years ago when it was a great plan to do micro-targeting of resources in some of these same communities. I don't know what the hell happened to that. I haven't heard anything about it since that press conference. This is a problem because we actually know what to do. We know what to do, we know how to do it, we're just not doing it. And that's really the crux and frustration that I have here. So I'm so thankful to the chair for having this hearing so voices can be heard. I hope somebody cares enough to make some changes so that the next hearing, you're not asking the same questions and getting the same answers that we've been getting for years and years. And I do want to shout out Kay Bain, who is my brother from another. He's going through some things right now that his administration has treated him very poorly. Some other groups have gone through the same thing. And there's a lot here. But, this is a great program. We should be expanding it and building upon it and really providing infrastructure so that it is really a part of the public safety discussion, not an aside. Thank you.
Thank you, Public Advocate. We appreciate you being here. And we know how passionate you are about this work. And, thank you for being spearheading this when others didn't see it. And so I'm happy to continue to do this work and push it forward and hold them accountable because I think we're all on the same page around the frustration of how this work has not really evolved. Do you have any questions? Okay. Okay, so I'll jump back in and give Councilman Williams some more time. How did DYCD determine which schools would host conflict mediation programs? What criteria and data was used to inform this decision?
Thank you for the question. So we are doing our we're Youth Enrichment Services initiative with New York City Public Schools, and they provided us with a list of the top 50 schools, including standalone schools and campuses that have the highest level 4 and level 5 cases, which are suspensions, students carrying weapons to school, etc.
Thank you. How many schools are you currently in?
50.
50. Some providers have declined or withdrawn from the Youth Enrichment Services contract, citing that the $40,000 allocated is insufficient into operating a program effectively, which it is. Is this service still being offered across CMS sites? If so, how many schools is this program operating in? And are you currently experiencing challenges in identifying providers that will willing to take the contracts at the existing funding levels?
Yeah, so the price point currently is not $40K. For standalone schools, it's $93K, and for campuses, it's $135K. And
What's and with $93K, still not a lot. What's the program model that I guess or the vision around that for the providers?
it's conflict mediations in schools, workshops.
Can you talk about the structure? Like what do you want the staffing structures to be with 93K?
Yeah, so we have conflict mediation specialists that are in the schools. We also have ancillary staff that's part of the model.
So in the model, how many staff is supposed to be?
I think, I'll allow Karina to answer, but I think it's 4 staff. We have a flexible staffing.
So it's supposed to be about 4 staff.
Yeah.
So 4 staff.
And they provide also.
Are they all part-time?
No, they're not all part-time, and that's the change in the model structure this
At
year.
93K?
At 93K. Yes, so at 93K, that is able to, right now, with the standalone.
That's a
school-
salary.
Right. Absolutely, absolutely. And these folks, they do a lot. They do conflict mediation, they do safe passage, but yes.
So
for
the model is
standalone
for
schools,
staff,
93K.
and so what's the, like, what's the range in that, and it's full-time, what's the range? Because at this point, you're spending all money on staffing, you have no OTPS or anything with this, so what's the expectation around this?
Yeah, so the expectation again is we went from 40K to 93 for standalone to 135 for campuses, right? We know that's still not, the best.
I just want to tell providers,
However,
do not take this contract. That is ridiculous. When we talk about underfunded contracts, ridiculous. $93,000 for a program to run effectively, you're setting people up for failure.
So I want to be very clear. So the 93K is for one standalone school. The 135 is for a school campus. Which is,
I didn't make
again,
it better.
Right. Doesn't make it better. But I just want to clarify for the record.
Oh my gosh. All right. I just want to say that I make it better. 93K and the staffing model is is that something that rolled over from MOCJ?
Yes.
Okay.
Yes, it did roll over from Mockja.
Yeah, I want to take this contract. That's a setup. All right, providers have expressed the lack of dependability year-to-year funding, creating instability that calls CMS funding and is calling for CMS funding to be baseline. Has the agency had discussions with discussions with OMB around baselining CMS funding?
Yeah, really, really good question. I would say this, and you heard this in the opening remarks. However, we're excited that this year, in FY26, that all the contracts have been registered, and that these folks are going to.
They all been registered?
Yes, all have been registered,
Oh.
and then they will be receiving 50% of their registered contracts.
Because I remember it was 2 years ago. Didn't the commissioner say that they was going to have an RFP that came out 2 years ago, right? That hasn't come out, did it? Okay. Well, you told me that. I remember Darryl was there in the meeting. I remember that you was there.
At the office.
Yeah, at the office, yeah. They told me. It was like a year ago. Providers have, huh?
So she was there too.
Oh, she was? Oh. Yeah, didn't your guy say that? RFP was coming out like a year ago?
No, but the RFP process would begin.
Nah, y'all said it was coming out. I was at that meeting.
RFPs take.
I know how long an RFP, remember, I'm a provider, I know how long an RFP take, but the concept paper, I remember in that meeting, they said it would be out that year, and yeah, here we are. The current CMS contract only funds 8-hour work days, 5 days a week, yet providers are often working around the clock in their communities. What changes can be expected to see in the upcoming RFP or concept paper to ensure staffing levels, compensation, and operational support reflect the true demand of this work?
Yeah, really good question. So, a few things. Folks do only work what we would call one tour.
I'm saying that again, I'm sorry?
One tour.
Oh,
which
one
is just
tour.
Yeah,
Oh.
one tour. Right? But
my
we
earpiece is going.
we are actively working with our providers on the ground to make sure that when there are high violence periods, such as evenings and weekends, that those times are staffed, right? So we understand that one tour is not enough. However, we want to make sure that when the providers are most needed, they're available to the community.
So how do they do that with just the one tour? So what does the compensation look like if additional tours need to be had?
That's not a question I can answer right now. I mean, that's something that we could get back to you on, Chair Stevens.
I just find it crazy that we would just have one tour. And even from when I was talking to providers, they said that sometimes it's only maybe like 8 of them, which is like crazy for a whole catchment area. CMS contracts expire June 2026. The providers are eagerly awaiting the RFP that will right-size budget and increase pay across all positions. When can we expect the CMS RFP?
So right now, we are through FY26, so we're good through FY26, and I think that we have an additional 2 years after FY26 that we could extend these contracts.
So your expectation is to extend them for the next 2 years?
Well, our expectation is to make sure that, in that, interim period that we are working to figure out how to sustain these contracts.
Given the dramatic increase in CMS payment process time from 130 days in 2016 to 255 days in 2024, what reforms are being considered to streamline procurement and ensure timely payments?
One of the things that we do and that we take great pride in is the sort of white glove treatment, as DYCD refers to it as, especially with some of our founder-led organizations or smaller-led organizations that need a little bit more TLC. Right, so part of what we've been able to do is work one-on-one with those organizations to meet any challenges that they have and to make sure that they get paid in a timely manner. We absolutely understand that this work cannot happen unless folks are paid on time.
Yeah, you guys know my fight about the payments. I think it's crazy that and this is the city as a whole, and this is the whole, not just CMS, but all the groups, just not being paid is just unacceptable. And like, as a city, we have to do better. And it just baffles me. And I keep saying, like, all nonprofits, I would be running down on it because you can't owe me millions of dollars and think I'm just going to do work and I'm showing up at their house. I don't know why y'all not at Gracie Mansion every day with my money, because that's what I would be doing. But, I could only give you my advice because I'll be running down. At the executive budget hearing, you noted, DYCD noted that legal service providers have been doing excellent work supporting young adults through referrals, hotlines, workshops, and those conversations on OMB were ongoing. Can you provide an update on the discussions and whether there has been any progress towards restoring funding for legal service providers?
What I'll say in general is that we're, consistently in communication with OMB to stabilize funding, right? And we understand that stabilized funding is needed for our frontline workers. We want to make sure that we're also.
But this was a peg, so this was absolutely cut, and this is something that I've been saying, like, we need, and every time, last year they were saying, like, oh, we'll meet with the providers, and at the budget hearing they were saying that you guys are in conversation with OMB. I'm just trying to get an update of what we're doing with this because, again, we can't piecemeal work, and I know that this was a peg, but most of the pegs have been restored, and I'm trying to understand why the legal services piece hasn't been restored, because it's a crucial part of the work.
Again, Chair Stevens, we're still in constant, in consistent communication with OMB just to stabilize our funding and just to make sure that we're addressing any emerging fiscal challenges.
All right, so I'll call Jack myself. What's the reason for the absence of CMS programs in violence impacted areas like Harlem Precinct 28, West Harlem 26, Inwood 34th, Washington Heights 30, in Longwood, the Bronx 41st? Are there plans to expand CMS coverage in those precincts?
Again, we want to use data to inform any decision that we're making on the ground. Right now, our summer safety plan is sort of an introductory or appetizer to what our future priority precincts might look like. As I mentioned earlier, we're in the 40th, the 44th, the 46th, the 42nd, the 73rd, the 77th, the 67th, the 32nd, the 23rd.
You're talking about for the summer safety plan?
For the summer safety plan, exactly.
Don't worry, I got a lot of questions for that. I got a lot of issues with that too. So don't worry. Don't you worry. Your pretty little face. We're gonna talk about that summer plan.
We're in 13 precincts for the summer safety.
I know. How are you identifying communities in need of program, and what barriers prevent your expansion into high need areas?
So again, I think it's important for us to make sure that we're utilizing and leveraging data for any type of on-the-ground decisions that we're going to be making with our providers. All right, and so as Assistant Commissioner Ray.
So when you say you're using data, the data shows that these areas have high gun violence and has a lot of things that are going on. So the data is already showing it. So then how are you using that data if we're not expanding there?
Sorry, please continue.
No. So that's what I'm trying to understand.
Yeah, so there's several criteria that is attached with any additional precincts or catchment areas that we enter, including, as you mentioned, high violence, rates of high violence, right? But we also want to make sure that we're able to implement this properly and safely.
Based on the data, how can the city better understand why CMS programs succeed in some precincts but struggle to reduce shootings in areas like Brownville or East Harlem despite longstanding intervention efforts?
Thank you for the question. Yeah, I think this is one of the reasons that DYCD is really looking to get more on the ground with our implementation assessment, is that we know that there's essential components for the programs, and we want to understand, what's working in what context and really what's going on in the individual communities. And so we want to make sure we have that kind of individual contextualized information.
I never heard people talk about data so much, but using old data. It's really driving me crazy. So I'm going to pass it over to Councilmember Williams right now.
Thank you. I just have some questions. I have a lot of questions, but some of my initial questions are to some of the things you said while being questioned and the testimony. So there was a discussion about the data and the fact that the ONS supervisors or managers get the data first. Can you just share a little bit more about the internal hierarchy within ONS? Like, how does it trickle down from, I guess, assistant commissioner to executive director to supervisors to then the CMS providers themselves? And can you share a little bit about, like, their expertise? Like, who are these people? What qualifies them to do said job?
On the ONS staff?
Macro.
Right. Yeah, so I'm the executive director. Dr. Christensen is the deputy executive director. We have a data unit, and we also have a series of borough managers and IMs that work directly with our providers on the ground.
Okay. And the expertise of the supervisors? Because you said the supervisors are the ones that are triaging data, or is it the data team that's triaging the data before?
Right. Yeah. So what typically happens is that we receive the data, and I want to be very, very clear here. DYCD is not the only city agency that's, in charge of this data, right? So we're receiving this data from the NYPD, right? And so we have an agreement with the NYPD on how we are able to distribute this data.
Yeah, I just want to
Right.
understand. I'm trying
And
to get a
so-
sense of, like, the expertise that is essentially filtering things down to the ground. Like, who are these people?
So our IMs
And I'll
are,
Google you guys to figure out who you are, like what you got your PhD in. Like, I'm just trying to understand what qualifies you all, and then the people that work under you to then.
Yeah, so our IMs work directly. We have IMs that work directly with our providers who are on the ground, right? We have an IM that represents each borough, and these are folks who serve as thought partners with the providers, to troubleshoot challenges that they might be going through. They do site visits.
So are they triaging the data?
So triage, using that verb.
You use that
In other words,
word,
I did
yeah.
use that verb, but using that verb, what I meant was the data comes to our IMs, and our IMs are able to,
What's
pass
the
it
IM?
along. The initiative managers, excuse me.
Okay.
And so the initiative managers are able to, take that data to the appropriate provider on the ground and share it with them, and they're able to think through what a response would look like.
Okay. The other question I had on the testimony was about intentional integration into DYCD's network of services. I heard the words, but how does that operate in practice? Like, what does that look like?
Yeah, so DYCD obviously has, for a very long time done youth services and community development work. And so what we are able to leverage are the existing resources within DYCD, including their workforce initiatives, data systems, in order to synchronize that with the work that's happening on the ground. And that also helps to inform the work that's happening on the ground. So CMS obviously is a collection of concerned citizens and community-based organizations that want to make their community safer, right? And so when you speak to a credible messenger, the one thing that they'll tell you is that you can't tell somebody to put a gun down if you don't give them something to pick up, if you don't give them a viable alternative. And a lot of those alternatives, such as youth services and workforce programs, live at DYCD. So we're trying to synchronize that with the
Yeah, so how does that actually work? So if I'm at, Eric was looking at me. So if I'm at Life Camp and, you know, I'm trying to do some type of workforce program at DYCD. How are you all integrating that? Like, what does that look like? Because you're saying trying, but then, like, are you doing it or are you trying to do it? Like, what does
Yeah,
that look like in practice? I'm like a very practical person. I need to know, like, we do this, we send them here, what does it look like?
So, 2 examples. One, we have a neighborhood strategies group that is under Deputy Commissioner Rattray, and they have neighborhood convenings that the CMS providers are invited to, along with Compass providers, which is, you know, after school, our workforce providers.
That was my brainchild.
Well, it is happening, but neighborhood. So we do hear you and listen. And then there's by initiative where if you want CRED, for example, or any of our workforce programs would present at a CMS contractor hearing to talk about the workforce programs and how to make the referrals between, for example, CRED and a CMS provider. So there's neighborhood, and then there's by program initiative as well. So.
Okay. You also testified that CMS programs now receive standardized site visits, and you talked about the evaluation. So I just wanted to get clarity. Do you now have a standard evaluation process across all sites?
Yeah, so there's kind of 2 different pieces to evaluation. So there's what I call like little e evaluation and big E evaluation. So there's evaluation, so that's referring to like the little e evaluation. That's really our evaluation and monitoring system at DYCD. So that also lives in DYCD Connect, and across all DYCD programs, we have our EMS evaluations, or evaluation and monitoring evaluations, that have standardized indicators based on kind of universal concepts across the agency, and then specific to the program areas and their scopes and goals. And so each program under CMS has specific indicators and has a structured schedule. And so, like for Cure Violence, there are quarterly site visits where the initiative managers are going on the ground, assessing the indicators and entering it into the system in a standardized way.
Okay. The other question on your testimony, I didn't even get to my actual question, but you said DYCD also regularly convenes with NYPD to understand data trends. Are the CMS providers a part of those discussions, or is this just the people that work directly for DYCD?
Yes, so right now we do meet regularly with NYPD to discuss data trends, as you mentioned, council member. And right now those meetings are just between NYPD and DYCD.
I want to believe that y'all are like experienced, but I'm struggling to understand the triage system that you all have. About the evaluations, can you share the reports, the reports that you have generated through your evaluations?
Yes, we can get back to you, and I believe a lot of it will be on our open data as well.
Okay, and then you also mentioned this, and it was in the testimony about contractual scopes. So can you talk about what those scopes are?
Sure. Do you speak about the scopes?
The scopes in the contracts.
What's the specific question? My apologies.
The scopes in the CMS provider contracts, because you said you testified and said specifically that the result was the need, you onboarded programs into the agency and assessed not only their scopes but also their data collection needs. The result was the need to further clarify metrics through contractual scopes. And when I asked the question about data and reporting, it was also mentioned that a part of some of the metrics that you all evaluate groups on is based off of their contractual scopes. So I wanted to know what those contractual scopes are.
Oh,
Sure. I mean, they are, the scope outlines the key deliverables and activities. In the testimony, it was described that the core model within the community-led approaches to public safety scope is a cure violence model. So it would outline the canvassing work that happens to be on the ground in community. It looks at the key metrics and goals and deliverables, for example, for the caseload for an outreach worker. So it sets the model, deliverables, the program activities, and then it
So
also
only
sets
canvassing
milestones.
and case management?
No, it's a
okay.
very long scope. I'm sure we can follow up and share the.
We had asked for that before when CMS was under MOCJ and the administration didn't give us the information. We asked for this almost 3 years ago now, and we never got it because it's hard to like even intelligently analyze or critique something that we don't even like. We don't know what you're asking them to do, and that was never given to us. So it's
given, but it's redacted.
yeah, it was given, but they redacted the actual scopes of the contract. So it's something that we've
follow up on that
struggled
and
to get.
an answer for you on if we
Okay.
can share those scopes. But they are many, I mean, I think they're about 10 pages long, single space. They're very detailed about hours, locations, staffing model, the job descriptions for the different required staffing,
Okay.
caseload specific. So we know that this is work that requires lower caseloads because each young person needs more time. So we set out the standard of 10 to 15 per outreach worker for a caseload. So it's the way to describe, to really translate a model into practices and then to set the milestones for any of those practices to say, this is what the expectation would be at scale, and then of course implementation happens and implementation meets challenges. And so the scope is really the guideline for the goals of the program and very transparently how it will be monitored in terms of meeting those scope deliverables.
Okay. How is DYCD ensuring uniformity in funding, training, and operational support across all CMS sites?
Well, I can say that all full catchments receive the same funding amount. And we have a handful of just a very tiny number of partial catchments, but each full catchment is funded at $1.6 million. And again, has the same standardized scope with the same standardized hiring requirements. So each scope, requires that there's a program director, that there's a certain number of outreach workers. So those standards for milestones, standards for staffing requirements, standards for data reporting, for incident reporting, those are all standardized across all scopes. And now with the integration within DYCD Connect, we have both data reporting where all CBOs are reporting the same metrics into the system. And then also the flip side of that system, what Jessica described, is the EMS, which is the way for the initiative manager to be really, we're in partnership with the partners that are doing the work on the ground to identify, here's the universal indicators. Some of them, like Jessica mentioned, are things like, is the physical environment of the office safe, right? That any program would need to be able to demonstrate that they're operating in a safe environment in terms of the fire lanes aren't blocked, that there's a welcoming environment.
So all CMS groups are uniform in terms of funding, training, and operational support.
Yes, we offer the same.
I'm looking at like a contract award, and one group is getting X amount, and then we look at other CMS groups, and they're getting another amount.
I can answer. Okay, I think I understand what you're asking. Each catchment is the same standardized amount. If you're asking, does every CBO receive the same amount of funding? The answer is no, because each CBO has a different collection of. Each CBO has a different collection of contracts. So one CBO might have 3 catchments.
So there's no uniformity. We can move on. There's no uniformity. There's no uniformity. Even if there's different contracts, right? That's to say that like one org maybe has, contract ABC, one org may have contract D, it still results in a lack of uniformity in terms of what can be provided to the community. Under CMS, no? Why is everyone so confused?
Absolutely. But I was mentioning the scope requirements. So there's
I know, but the question was just in general, but we can move on. I think the answer is like,
yeah, and also
there's no true uniformity really. Are all sites receiving funding that reflects the true cost of operations?
Well, listen, I think you know, we can always. This is a model in which that, and this is a model that we could add more funding to. Obviously,
Okay.
Right now,
That's fine. It's
there is
giving me a
uniformity.
political answer. How is DYCD coordinating with other agencies? So, like the public advocate mentioned this about like integration, and that's actually my biggest gripe. I have two biggest gripes. One is the lack of uniformity, and I know different communities and different providers are experts in certain things. I can call out different ones that I know are good in workforce versus therapeutic healing models. And so I know that not everybody needs the same thing, but uniformity and the lack of true integration is probably like my biggest gripe with the system. So how is DYCD coordinating with other agencies, NYPD, DOHMH, New York City Public Schools, ACS, et cetera, to institutionalize CMS as a core part of public safety infrastructure?
Yeah, so the first step that we're taking is that we are collaborating with other city agencies. So we are collaborating with those city agencies that you just mentioned, the council member. We collaborate with DOHMH on our hospital-based violence intervention programs. DOHMH also provides a strong messenger project to our folks who are on the ground, which are individual and group therapeutics to credible messengers. We know that credible messengers suffer from, you know, compassion fatigue, vicarious trauma, et cetera, right? So we're working with them in that sense. We're working with ACS with their Close to Home initiatives, right? Providing conflict mediation, conflict mediators and credible messengers on site at their facilities. We're working with NYPD around data, obviously, you know.
But isn't that like a separate contract? Like I know of a CMS group. Yeah, like that's not you. Like that, like this is a separate contract. Like I know some CMS providers that are doing work in a secure facility in Queens.
Right.
That's a separate contract.
Those contracts are,
with DYCD.
yeah.
So they're through CMS?
Yes, through CMS, and
Okay.
that's the magic of CMS. CMS has these wraparound services that when you connect them to folks who are on the ground who are at an elevated risk of being involved in violence, it inherently reduces their risk of being involved in violence.
So DYCD also funds the hospital-based violence intervention work. We work really closely with H&H and DOHMH, as Cliff mentioned, the work inside secure and non-secure detention facilities with our partners at ACS, and of course working closely with New York City Public Schools for the youth enrichment program. So we meet with them bi-weekly, more really, but we have, you know, set meetings every other week. There's data sharing in terms of like program outputs, you know, between the agencies, and we're in really close collaboration with our agency partners.
Yeah, last time the commissioner was here testifying, we asked about the integration specifically with CMS providers. Not you, but like how it trickles down. And the only thing that he mentioned was that CMS providers are invited to roll call at the police precincts, which I found like completely inadequate to like really developing relationships with local precincts. So do you have anything else you may want to add about how on the ground you're working to help integrate the CMS providers into the public infrastructure, like on the grounds, not high level, because I feel like there's a lot of like high level conversations, but not a lot of on the grounds conversations.
On the ground with other city agencies, with the work that they're doing?
Yeah, and the CMS groups who are actually doing the work.
Yeah, so part of what we're doing with NYPD, I could tell you, council member, is we're working with them on a joint curriculum where we're integrating the CMS work into the PD curriculum so they understand that there are other folks who are occupying these spaces and who are interfacing with the same populations that they're interfacing with, right? So,
I think that sounds like a great thing long term, but I don't think it speaks to like what you're currently doing to make those connections.
well, yeah, so that's something that is, I wouldn't call it a long-term goal, but it's something that we're currently doing, again, to just further integrate our CMS work into some of the public health and, the public safety infrastructure in the city.
Do you have any short-term goals?
any short-term goals to make sure that we get these folks paid and to continue to support
Let me
them.
just quickly ask the rest of my questions before the chair kills me. How are you incorporating the leadership and guidance of community noted experts, the original architects of the system, and current operators in design capacity and policy implementation?
Yes, so again, we have weekly, bi-weekly meetings with our providers who are on the ground. We also have monthly steering committee meetings and various touch points where we invite providers to share their inputs and recommendations. And that's something that we are always, working on to, better this entire model and system.
Okay. That's all for now.
Well, I'm back. So I think, it's always great because in real time I get text messages from providers and stuff like that. So there was one thing I just wanted to ask around. I know in the beginning when CMS first moved to DYCD, there were huge convenings with all the providers like in the area. So they were bringing together after school program provider, cornerstone providers, and everyone so they can get to know each other. But some providers just text me that everyone wasn't invited. And so how often are those meetings happens, and are they happening, and what does the outreach look like? Because some of the CMS groups who are here in this room right now said that they have not heard about those meetings or was not invited to those meetings, and that's very concerning for me.
I'll need to get back to you on that. As I said, it's overseen by Deputy Commissioner Rattray's team. I know the convenings are happening.
Well, I know they happened. I was invited to some.
I don't have the list of who was or wasn't invited, but I know that they are continuing to happen.
So they're
but
still
I will get a
happening
response
currently?
to you. Yes, I will get a response for you. They have a whole neighborhood strategies team now, so that is what they focus on.
I know some of them happened because I was invited to some and I attended some. But what I am saying to you is, as we were sitting here, providers text me and said they have not heard of these meetings and they were not invited. And so that is a red flag that I am flagging for you. So if they are continuing to happen, we need to make sure that we're doing all the outreach because I think it's important. And that was one of the things that I talked about a lot before they came over of how are we going to make sure that they have access to all the things, right? Sometimes the spacing and how are we doing collaborative programming and working together. And so I just want to make sure that we're doing that. And don't worry, I know you'll go back to Daryl, but I will also be texting him as well.
It's never our intention not to,
Things happen.
integrate the entire
Listen,
CMS.
as we were sitting here, folks were texting me and said that they did not hear about these meetings.
Fair enough.
So I'm telling y'all. And then the other thing is, it was some confusion around CMS and cure violence. And so they wanted me to also just point out that cure violence is what they do in Chicago, and CMS is what we have here, and what you guys have been talking about has been more cure violence. And so I know when they come up to the dais, our providers are gonna make sure that they clarify that because they also feel like even how it's being explained is not correct. And so maybe that's some of the disconnect that we're having because what you guys are talking about isn't what they're doing, because I'm getting a whole bunch of text messages about that as well. But I'm sure they're gonna clear it up. So hopefully you'll stay around so you can hear them give the history lesson. All right. So, how was the agency engaged in CMS providers since the transition in DYCD, both understanding the challenges involved in them shaping future program design and evaluations? And so, could you talk a little bit about some of the, well, no, we already, you know what, I'm asking another question. How does DYCD coordinate across the several agencies oh, you already asked this one.
I did.
You did.
I didn't even know. That was my own question.
How is DYCD integrating CMS and violence interruptions work in their youth services, such as Cornerstones and Beacon programs?
And that's a wonderful question. And so again, our Gun Violence Prevention Task Force right now is activating spaces over the summer, Cornerstones and Beacons.
You know what? You want to talk about this summer program so much. Let's get to it.
Well,
let's get to it.
I
You
think it's
brought
a
it up
wonderful
500
initiative.
times like it's the best thing ever, and I got a lot of issues with it already. So you keep bringing it up. So let's go to it.
Well, it's the summertime, and so we want to make sure that we're.
Oh, I know it's the summertime, and I'm in the Bronx, so trust me, I know. My district sometimes turns into a shooting range, so this means a lot to me. And I know, like I said, I met with the task force last week, and they had a plan that you guys put together. You're in 13 precincts, and you're activating these sites. One of my biggest concerns is the people that we're trying to get ain't going to the site, so how's this going to work? Because I know what's the plan around it?
Well, the plan is to make sure that we're fully integrating our CMS providers because we understand that the CMS providers are the
What does that
conduit.
look like in real time? So you're saying integrating. What does that look like? Like walk me through it. So you're saying integrating. I thought you guys said they were already integrated, but what does that look like? What are they going to be doing in the programs? I know, like with the cornerstones, a lot of times the cops are there and they're required to be there. Our CMS group's going to be there. So talk me through what that looks like.
Through co-locator agreements, we're going to be able to engage our CMS partners and by proxy the folks who are at elevated risk of being involved in violence, and hopefully they're able to take advantage of these safe spaces, cornerstones, beacons that are going to be
So
open
at
for
all
extended
13
hours.
sites, do you guys have a CMS group that's going to be assigned to that location?
Yes, we should, I believe. Yes, we do. Yep.
Okay. How's this? How have providers, including the CMS groups, given input on this plan?
Well, we've been meeting with the CMS providers around the summer safety plan, right?
So I know
And
you
this is
guys have
the
been
second-
meeting with them. That's not what I'm asking. How has their input been implemented into the plan?
We've been meeting with them. We've been receiving feedback from them in these meetings. We've been asking them, how can we transform this space for your young people and for your participants?
But some of the but that's where I'm confused at, because that's why I'm saying how they input, because remember, I know programs. So the places that you're activating are typically the cornerstones, right? That's where you're activating. The CMS providers are not necessarily the same people who are doing that work. And so you're saying that you've been talking to the providers. I'm saying specifically, how are we integrating the CMS workers into this work, and how's their input been implemented? Because we know sometimes it might be a different provider who's a different site, and it always don't work out as nicely as we're saying it. So that's why I'm asking you to walk me through it, because that's not just saying we've been meeting with them. We know that's not going to just be it.
Yeah, so we do have the co-locator agreements that is between the cornerstones and specific community-based partners for them to be able to utilize that space, right?
So what will be the responsibility of the provider, and what will be the responsibility of the CMS groups that's there?
So the provider would have to create this safe space, and then the groups are able to come in and utilize that space as they see fit, right? And so part of
Okay, so walk me through it, because I'm still not understanding, right? I'm a provider. I have this community center. I'm running program. So I'm in charge of running the program. What is the CMS group doing? Because they're not the same people.
No, they're not the same people.
I know.
What I'm saying is the CMS site or the CMS provider is going to be invited into this space to be able to utilize that space with their participants.
Okay, but understand my
And there's gonna
pushback
be
where the
an agreement in
confusion
place.
is, right?
Right.
Because it's an agreement, right? So other than the agreement, this is why it doesn't make sense. Because if you have the provider and they're providing programming, they have their program, then the CMS is just coming to use the space.
Yeah, they are coming to a safe space where young people can thrive. They can play sports. They can work on a resume. They can work on a cover letter. Like that space is going
So I
to
just
be
want to tell you,
utilized as they see fit.
I'm giving pushback. I ran community centers for 20 years. So this is why I'm giving pushback, because I already know how I'm rolling. If somebody comes in and be like, you have to have an agreement to do work here, what does that look like? What are their responsibilities? What are my responsibilities? Are they bringing their own kids? Do they have to do their own recruitment? Because even with the agreement, we have to have things outlined.
Right.
So that's why I'm asking, what is the agreement? What is the responsibility of the provider? Are they just providing the program? Is the CMS groups just coming to show up? Do they need to bring their own kids? What is the agreement?
Yeah, the CMS provider can bring their participants and their young
But is that a requirement of the agreement? Because I'm telling you, this is if you haven't thought about this, I'm telling you, it's going to be a problem now. Because I would have a problem with this as a director of a community center. I would have a problem if you're just like, hey, we're providing space, so that means don't talk to my kids, because that's what'll happen too. Like, let's not pretend like people won't come in and be like, all right, well, where's your kids? Did you bring kids? That's what I'm saying. What is the responsibility of the provider? What is the responsibility of CMS?
So Chair Stevens, I think globally, the important thing to understand here is just the activation of spaces. Gun Violence Prevention Task Force is a sister program within DYCD, right? I could leave it up to them to, after the hearing, to provide specifics. But right now, as it relates to CMS providers, I think activation
You
of
guys
spaces
should
is the
not
important
be
thing.
a sister program, and you guys should all be working together. And so that's my frustration in this moment. I'm just a little frustrated, because you should be able to say, hey, yes, in the agreement, the CMS they're coming in and they're going to do ba, 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 ba. They're going to help with recruitment. They're going to do outreach. And the providers, they're going to be able to provide the space, programming. They're going to be doing these activities. Like, folks have to submit work scopes. So that's why I'm a little bit confused on like what the vision is. It seems a little bit all over the place. And it also seems disconnected because when I spoke with the task force, that's not what it seemed like they were doing as well. So I'm a little bit confused. I'm not gonna lie. Because I feel confused.
Yeah.
No, we can swear you in. Don't worry. It takes 30 seconds.
Hi. Yep, just raise your right hand. Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee and to respond honestly to council member questions?
Yes.
Thank you.
So just in terms of the summer safety plan, we just had planning meetings with CMS providers and Cornerstone and Beacon providers yesterday. And so we are in the process.
Right before the hearing.
We are in the process. I mean, this is all happening in real time. It's summertime, I know. But we're in the process of figuring that out. But the goal is for CMS to come in and provide programming to do outreach and engagement with their young people, but also to co-design what the program overall looks like within the Cornerstone or the Beacon where said activity is going to be happening.
So do you guys understand my pushback? Because in a perfect world, it's like, okay, they're just going to come in and do programming. I'm just saying that there needs to be real tangible agreements between the two.
Absolutely.
Because it's not like to just be like, oh, everybody's going to show up and we're going to be in harmony. We already know that people, this is part of the problem, and we've set the system up this way where people are fighting against each other in programs opposed to working together. So coexisting sometimes takes time. And I have the same argument with Summer Rising. Don't get me started. So why are we now going to create another chaotic system in the cornerstones, right? And so for me, and it's a little different, right? Because the provider then is going to be like, this is my space. And now you're going to have other people entering their space. I just think that we need to have much more clear lines of what the expectation of CMS groups are when they're going in that building and what the provider's expectations are and what that looks like. Like, we cannot just like leave it up to say we're going to figure it out. So I just want to make sure. That's why I'm pushing back so hard. I was in a gym for 11 years. I had 3 programs. I'd have been like, you guys are crazy.
And I appreciate the feedback. Like I said, we are kind of in the process of a planning. We've initiated a planning process, which is happening. And so certainly we'll take these notes and incorporate that into what some of our plan is. But it also is some things that we have been considering and why we know we actually need to work with both the youth services providers as well as the CMS providers to develop the plan before we get to July 7th.
How are you guys working with the council members also to implement this plan? I know specifically in the Bronx, we've been talking about a summer safety plan because we have so many shootings and it's so reactionary. So I'm just trying to get a better understanding. How are you guys working with the council as well?
So one of the things that we're planning on doing and that I think Andrew is helping us pull together is briefings with all the council members in the impacted precincts so that they're aware of the plan. And
I'm sorry, if folks are stepping out, could you please step out? We are still in the middle of a session. Thank you.
So that they're aware of the plan and we're able to engage their offices in supporting the plan.
I just want to say, this is. I know a lot of CMs get upset because we always feel like we're getting briefed and not part of the process, right? And then what happens is we get the backlash when things come because our office is usually the first line of defense. So I think like if you're still in the planning phases and you're in these 13 districts, it would behoove you to see how involved that those members might want to be because this does affect them in a real way. Okay, I think that's all I have for the summer safety plan. Okay, no, how are we integrating NYPD into the summer safety plan? Because I know that's usually a big thing where with those sites that are activated, NYPD is typically activated, which don't get me started, it kind of annoys me, but.
We are in the process of actually trying to get a planning meeting on the calendar with NYPD. I know Darryl and others have been in touch. So we're certainly working to integrate them into the plan.
Okay. I have some questions about legislation intro 992. What details does DYCD believe are appropriate to share publicly and with stakeholders about provider contracts and obligations?
So I'd say, generally speaking, ONS supports efforts to promote transparency and community engagement. We do appreciate the bill's intent and alignment with CMS values, but we're still reviewing to make sure that they're, just to gauge implementation impacts.
What is DYCD's current process for informing council members, community boards, and NYPD precincts about the providers' assessments in their district? Assignments in their district, sorry.
Assignments in district. We need to get back to you on that.
I can tell you
Well,
now,
we have
it's
regular
not
meetings.
one.
Yeah, we'll have, yeah.
It's not one.
We have
It's
regular
okay.
meetings, yeah.
There's no
Setting
regular.
up pretty good
I know my CMS groups because I'm very active and I talk to them and I call them all the time
Right.
and we work closely. But I don't think that there's a formal process. Does DYCD have a significant resources needs to improve the website, updating reporting or notification systems systems required by this bill? So do you have adequate resources to be able to implement this on your websites?
Yeah, we're currently working on updating our website right now.
Well, I think those are all the questions I have for now. It wasn't too bad, was it? I told you they set you up at the start of it. But thank you guys for coming. We are going to open for, I gotta read this. Where? We're gonna be opening for public testimony. Thank you guys for coming in. I now open the hearing for public testimony. I remind the members of the public that this is a formal government proceeding and decorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recordings or photography is allowed from the website witness table. Further, members of the public may not present video or audio recordings as testimony, but they may submit transcripts of such recordings to the Sergeant of Arms for inclusion in the hearing. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant of Arms and wait to be recognized. When recognized, you will have 2 minutes to speak on today's topic, evaluating the crisis management system under DYCD. If you have written testimony or additional testimony you wish to submit for the record, please provide a copy of the testimony to the Sergeant at Arms. I will now call the first panel. Dr. Charles, David Koba, and Galloway Ali Forney Center. Yep. Mhm.
Lamaria from the Gun Violence Prevention Task Force. Oh, she's.
Good afternoon, Chair Stevens and the members of the Committee of Children and Youth. My name is Galloway and I serve as the Advocacy Manager at the LA Forney Center, the nation's largest organization dedicated to housing and supporting LGBTQ homeless youth. But I'm here today to talk about strong support of Intro 1245 and Intro 1246 because our youth deserve more than a system that simply ages them out. They deserve a city that ensures they are seen, supported, and set up to thrive. Every day at LA Forney Center, we meet young people, most of them Black, brown, trans, and queer and non-binary youth who are forced to leave foster care at the age of 21 and land them into the shelters the next day. In NYC, over nearly 1,000 young people age out of foster care each year, and the outcomes are devastating. Within 1 year, 10% enter into homelessness, and by year 3, that doubles. And what we know is the data is showing that 31% remain in care past 21 in 2023. So why is this? Because we failed to build bridges from foster care to stable adult housing. In order to do that, we need to make sure that we bridge those gaps with Intro 1246 by ensuring the city to establish a program that supports young people aging out of foster care when we finally are recognizing that when they turn 21, that doesn't mean that they might be ready to navigate housing, employment, and healthcare. So why are we setting them up for that? Also, just want to name the support of 1245 is equally critical because without comprehensive data, we cannot ensure that we have sexual orientation, gender identity, and the full needs to be able to support those youth, especially LGBTQ youth. So just ensuring that we get disaggregated data helps us drive solutions and better meet the needs of those youth. We are failing them, and these bills and policies are going to be there to protect them and ensure that we have the investments needed in place. We urge you to pass Intro 1246 and 1245 to ensure young people leave with care and be able to see themselves thriving more in this city. So thank you so much for this opportunity to testify, and if you have any questions, I'm here to answer them.
Good afternoon. Thank you, Chair Stevens and the members of the Children and Youth Committee for the opportunity to testify on the oversight of the crisis management system under the New York City Department of Youth and Community Development. A lot was said already, and pardon the redundancy, but I want to make sure that you do hear our testimony. Thank you. My name is David Caba. I am the Senior Vice President overseeing the Bronx Rise Against Gun Violence Program for Good Shepherd Services, which is a part of the New York City Crisis Management System that operates within the confines of the 4th, 6th, 4th, 7th, and 52nd precincts in Council Members Pierina Sanchez and Kevin Roddy's districts. I began my journey with Good Shepherd Service over 10 years ago as a program manager for GSS's first community violence intervention program, known as BRAC, Bronx Rise Against Gun Violence. What started off as a pilot program of only 4 staff has grown to be a multi-site program of over 70 staff. Since then, I have been dedicated to growing leaders within the CMS community, which includes being a trainer for the New York City Department of Health and Mental Hygiene Training Academy, elevating the need for the city to value the lived experiences of the individuals doing the work on the ground and also share best practices among the CMS network. Based on Controller Lander's report recommendations, my testimony will focus on the collective priorities of the New York City's crisis management system. Number 1 is to improve the city's management and coordination of CMS, including strengthened oversight. Starting with oversight of the CMS system is not all within one agency. For example, Works Plus, the workforce development component of CMS, is overseen by the New York City Department of Probation. As the council is aware, DOP threatened to cut the program. In our collective advocacy with Chair Nurse and Stevens, DOP agreed to fund it for 1 more year. This volatility threatens the effectiveness of the CMS. We also want to launch a real-time CVI dashboard. While all CMS providers are currently reporting to DYCD via DYCD Connect, our agencies have experienced oversight from 3 different agencies in the last 10 years, including DOHMH, MOCJ, and now DYCD. With each shift, there have been changes to the reporting, which only makes it more difficult for us to create data sets that share the effectiveness of the CMS. Data collection varies for the interventions across the crisis management system, would include hospital response, therapeutics, school violence interventions, and workforce development. I would add that we do a host of other collective approaches, strategic approaches to reach our youth in our communities and our neighborhoods. A database that captures the ecosystem surrounding the individual and his benefit is needed. Additionally, while we can share data for the community violence intervention work, that alone does not provide the full picture of the holistic work that CMS is doing in communities across New York City. What we are asking the city and the council to invest funding in is the following: conduct an evaluation of the New York City crisis management system as an evidence-based approach that supports creating a uniform way for CMS sites to capture effectiveness throughout the various components of CMS. Ensure the current database can interact with existing community-based data collection methods to allow for batch uploads for monthly reporting metrics. Many of us have kept our data for over a decade, but we have been moved from agency to agency. Increase DYCD's capacity to provide technical assistance to CMS sites and hire data analysts within CMS sites to support the internal capacity for CMS sites to capture and analyze data. We're not funded for that. In closing, the payment delays regarding late payments. We received full payment for fiscal year 2024 last week, June 9th. Fiscal year 2025 invoices have been dispersed or approved for payment by DYCD. I want to know the volume of unpaid invoices for long periods of time from city agencies is creating cash flow issues for all agencies, large and small. In addition to the recommendations proposed by the controller, the collective has the following recommendations. Activate a joint task force that includes the mayor, the council, the CMS leadership to revisit what is needed to strengthen CMS, including to explore expansion and funding levels that support various components of CMS, and to ensure the release of a fully funded RFP that includes a scoring system that ranks providers who are doing the work currently. The task force can also explore the creation of a New York City-based training academy to support the CMS workforce, since training is currently being conducted by Cure Violence Global in Chicago. And the viability of a 24/7 weekly operation for the CVI sites, where they're currently operating 8 hours a day, 8 hours per day, 5 days a week. So 2 days out of the week, we're not operating. The current contracts are set to expire on June 30 of 2026. We're going into the final fiscal year. We are asking the city to ensure that we have baseline funding to support CMS that accounts for the real cost of living, both for staff and agencies, as all costs, including rent, have increased since many of these contracts were first issued. We're talking about years, Council. Revisit the salary ranges for staff, ensure we are compensating for lived experiences and risk staff are taking in compensation that considers the true cost of living in New York City. Increase funding for the various components of the CMS sites. For example, therapeutics is only $50 grand. You talked about it a lot today, which is not enough to hire a social worker or clinical staff. There's a breakdown to this. When they give the numbers, you have to take that and break that down by the schools, campuses of more than one school, etc. Revisit the work scope and funding for the youth enrichment services, which was known as YES, which reduced the number of school service and changed the staffing responsibility, which is not aligned to the previous model. It has been drastically changed from what it was. Restore the $1.5 million in funding to the Community Justice Unit, which is operated by Legal Aid Society, which is detrimentally impacting their ability to continue providing legal services to CMS. CMS needs robust legal supports that include designated people focused on the cases of youth we refer. I want to thank the Council for hosting this hearing and for your partnership in advancing and elevating CMS in New York City.
Well, thank you. I want to go on record for saying I'm allowing you guys to go over because I know a lot of people have left, and so I'm just putting it on record. That's why, because some people have left, so I'm letting y'all use their time.
Straight ahead, but plus y'all, there was a lot said that requires clarity. Thank you for doing this, Councilwoman Althea Stephen and my Councilwoman Natasha Williams, and the rest of the folks who are not here. Before I start, I just want to address a couple of things that were said before, if possible. Clarity. This model, the New York City Crisis Management System, began in 2012 when we confronted Christine Quinn, who was running for for mayor at the time, and she started a task force, right? And I presented to her what we had at that time in Southeast Queens was a VIP system. We started in New York City as the New York City Crisis Management System, right? Regardless to anything else that happened. We are the New York City Crisis Management System. And the reason why we're in an extreme problem is because all of the city agencies, city officials continue to relate to us as we're Cure Violence. If we have a contract for $1 million, let's just say, Cure Violence is $500,000. We're never looking at the other $500,000, which puts us in a deficit, right? For our work, for our data tracking, for the folks who are overseeing us. They started the whole explanation of who we are wrong. So how are you ever going to evaluate or really work with us if you don't even know who we are, right? And I love the people who were here. It's a catch-22. It's really a bigger question than them at DYCD because as David just said, we went from DOH, we went to Mock J, then we're now at DYCD. And if a new mayor comes, they could say, we're not gonna be at DYCD no more, we're gonna put you someplace else. So the question of where we're housed and the baseline of our work has to be just as important as NYPD or FDNY. The unification is not someone coming in and doing an inspection of your work or a pop-in visit or a site visit on a weekly basis. It is how do we integrate city agents? How do we co-produce, right? The question under Commissioner Shea, we had a contract with NYPD. We met with them over and over again. We had a contract. And so like how they raided my office to get my video camera, that wouldn't have happened because we have an agreement. Is all you got to do is talk to me, right? So they're violating the protocol and process on how we are relating and maybe setting a new precedent on how they see moving forward with us. I don't know. Right? But I know that it has to be a conversation with NYPD at a higher level of the co-producing of public safety systematically, not based on friendships, not based on the city with the area with the highest violence or the elected official who advocates the most. It has to be a protocol and procedure that is systematic citywide, right? How did we get here? We got here, the crack epidemic in the 80s and the 90s caused a question of families being separated. Children going into children's services, fathers getting killed, fathers going to jail, mothers home, some strung out, disarray. That's how, there was 2,000 people killed a year. In 2017, 5 years after we started, we made New York City the safest big city in America. We had a weekend where no one was shot. We had a week where no one was killed. If it works then, it can work now, and it does work. It just is not invested in the capacity and the manner in which it needs to be. It is always an afterthought. We can't be an afterthought and be as effective as we need to be, right? And so NYPD used to share data. They don't share data anymore. We used to, in our catchment area, we used to meet about the data. Every catchment needs to meet about the data. It needs to be intentional. It needs to be on schedule. We need to study what we're doing and so that it can become effective, right? We have to be the ecosystem. It is an ecosystem. Just like our body, you can't cut off our hand and put it over there and it's gonna work. It is attached to our body, and CMS is a system, not a program. Cure Violence is one of the programs in the New York City crisis management system. And we gotta stop looking at us as a program and look at us as a system. Therapeutic mental health has no real funding, has no funding. It has to be funded if we're going to address it as a public health issue. Legal advocacy doesn't have the funding that it needs, and then we're playing legal Russian roulette. Like, we take the young person, we know these folks who are here, but when we get into the court, it could be somebody else. It could not even be the legal aid team that works with us. It could be a whole nother legal system because of the process in the courts. And so we have to change how our participants are represented in the court. We need connection with the judges. We need to have intentional meetings. We have to have intentional conversations with prosecutors around who is the participants that we're working with. Like they said, I saw a shooter coming out your office. You're supposed to see shooters coming out my office. That's who we work with, right? And so we need to be more intentional. The Peace Mobile is something I remember standing here and advocating for 15 years to get it. And now we have it, but it has to be systematic. Every piece, they call it mobile trauma unit. I don't call it mobile trauma unit because I don't want to mobilize trauma, right? We want to mobilize peace. And so, and no disrespect to anybody, but I came up with the concept. I brought it to the city. And so let's have it done the correct way. If you go to most of the Peace Mobiles or the mobile trauma units, we don't know what they're doing. We don't know what they have inside, right? So we need to have it unified, right? And I'm not saying it because I created it, but I'm saying it because I created it, right? And so let's make sure that they all look the same, doing the same thing. It could be different in some boroughs and some cities. I mean, not cities, because they have duplicated in other cities. But It needs to be unified. We need to be unified, right? The workforce program, like he just talked about, some of us don't even have it. We all don't have the same funding, right? Contrary to what they said, she's talking about cure violence. We all don't have the same. We all need to have the same funding, doing the same work so that we can be measured effectively. When you go to a police station, you know that every police station is going to have the same thing. Every fire department is going to have the same thing. Every EMT is going to have the same thing. Every New York City crisis management system in every target area needs to have the same thing. Survivor support needs to be an intentional, intricate part of our system. They need to be alongside of us, just like how we have the hospital work, we need to have the survivor work, we need to have the mental health work, because we can't say that it's rooted in public health and not address and fund it from the public health perspective, right? And so we need every site equally funded, every site professionally trained. We need an internal compliance team that helps keep ourselves in check, because we need to make sure that we are professionals, that we are growing professionally. We need to be uniformly equipped with the right equipment. Some people have vehicles, some people don't. And I mean just basic vehicles to get to all of these shooting responses that you talk about that we have to do every single week, at least 5 shooting responses, 3 shooting responses all over the borough, right? And then we need to, we need to track and measure with consistent data system. Now, Life Camp is building a database system, right? Because we believe in data, but we need to have one data system that even if we go someplace else, and maybe it's not owned and operated by the city, but that we can carry the database system with us, because we keep getting new database things, and it doesn't track the entire CMS model. The leadership must remain community-centered. Sometimes we have elected officials, they pick a group that they like, but it's not a group that is credible and capable of doing this work. And so everyone fits in the ecosystem, but everyone doesn't fit running the CMS model, right? They can be part of the ecosystem, but we have to keep it intricate to people who are real credible messengers, credibly conscious, culturally attuned to what it is that we're trying to do. Because then you have people like, I don't know if I could say them, but we have sites like Coney Island who doesn't able to order stuff just because they're in a bigger group that is not culturally attuned to the needs of the Black and brown children in that community. And so we can't have things like that. We need data that matches the work. CMS, we already said that stuff. Most of the CMS work is not tracked. Only a portion, like cure violence, is formally measured, yet cure violence often represents just half of the site's funding. And then it always goes back to Chicago. Why are we talking so much about Chicago, right? For me, the person who brought the concept to city council, right, I think I'm very attuned to help build any of this system, right? So I think I should be tapped into. David has been here for the beginning of time. Ife Charles, the beginning of time. We have people who are qualified to, and I just got a doctorate degree, so I'm a doctor now, right? And so we need to be the people who are building out the training, building out how we grow, consulting with these folks. There's a lot of meetings that they talked about that, I don't know what that means, but is that Jesus coming in? So we need to baseline the entire model, sustaining the progress and scale our impact. We need full funding for every part of the ecosystem, full funding for every part of the ecosystem, standardized training, branding, and operation across all boroughs, a centralized data system that captures outcomes from every intervention to every part of the ecosystem. We are building such a thing at Life Camp. The recognition of the models as a model, right? And not as an afterthought, we need to be part of those like Jamani talked about. And the other thing about what Jamani did, what tends to happen with the CMS model is we get caught in the political debates of the elected officials, the mayor at the time, right? And we don't want to be pawns for this stuff. We can't be, our work is too important. We can't be pawns for political personalities and feelings and et cetera, et cetera. We need true integration with city agencies. It doesn't exist. We need true integration.
Yeah, I need you to,
And
10
I know.
seconds.
10 seconds. True integration. That's it. That's it. That's the end. Yes. True integration.
And so I have a question, because I know you said that, Dr. Ford, you spoke about the data sharing that used to have meetings with NYPD, but those meetings stopped. When did those meetings stop for you and NYPD around data sharing?
She said 3 years, but for me, it stopped citywide after Commissioner Shea. After Commissioner Shea, it stopped. For us in Southeast Queens, it stopped after the Queens chief.
Bill.
No,
Kevin.
Kevin never did it. It stopped when he came in. Beltran. After Beltran, it stopped for us in Southeast Queens. And I've sent many emails to the Deputy Mayor of Public Safety, the Commissioner of DYCD. You know, we had a meeting the other day with CMS and the police department with the new Deputy Mayor of Public Safety, but we haven't gotten data yet.
You haven't got any data. And did Bragg ever have those meetings?
Well, I just wanted to say that we had a historic meeting of ComStat years ago at Police Plaza. It was after that you started to see the momentum dwindle to now where you actually have to hunt down your local precinct to then go over. One of the ways that's done is by going to precinct council meetings.
Yeah.
And then approaching them about the data right after that, because the commanders are reporting that. So for us, it's a matter of doing that. We go to all of the precinct councils and all the precincts that we're in, hear what the data they're talking about, and then talk to them afterwards. We can.
But you don't have like a formal meeting
standard,
where
no.
you are guys
scheduled on the calendar, no ma'am.
Okay. Makes no sense. And then just even around the Peace mobile units that you were talking about is something that I forgot to bring up today, because I see them, but I'm confused about what they do and what they're supposed to do. And then the inconsistencies, I see them at rallies, and that's how I know it's a rally, because you'll see them all out there, but just trying to get a better understanding, because there was a number of shootings in the Bronx where my question was, and I went to DYCD, I said, well, why aren't these trauma units out there to support the grieving folks and give therapeutic services after this has taken place? And they were like, we'll look into that. But then I was told that there's only there's only one per borough. And I was like, don't tell me that. I've seen them, so that's not true. So could you talk a little bit about
It's only one per borough. It just, we look powerful, but it's really.
It might be one per borough, but more than one group got it. This is like echo in my ear. But if you want to talk a little bit about.
We don't have an MTU at Bragg. We don't have an MTU at Bragg.
RTG has it.
RTG has it.
No, I know.
The SUV doesn't have one either, and neither does SOS.
Yeah.
Yes. 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 And some people have things that look like.
Yeah, that's what I was about to say. You may see vans that have all
Again, I hear you guys. I hear you. Okay. But they're still not there in the moment of crisis. So, could you talk a little bit about when you say you want us to see unification around that, of what that would look like?
Yes. I'm sorry.
And is that part of the contract?
I'm sorry. Can you say that again?
I was saying, could you talk a little bit about what the unification would look like and what that vision is? And when this was brought to the city, did you give them a plan around that unification?
Yes, but they didn't use it. But they just gave the money to each organization in the 5 boroughs and let them buy their own thing and build it out their own way. And so, and if you don't have you don't know what you don't know.
Yeah.
Right? And so to respond to the situations, some of the shootings might not be in their catchment area, right? Or anybody's catchment area, which is, and then they might not have staffing at the time that the response is needed.
Yeah, that staffing model is weird.
But the purpose of the Peacemobile is for, if you talk about origin, the purpose is for just that. The same way the police cars come on the scene at a shooting or incident, we should be at the scene. We should be at the hospital giving support to those families and that community. But that should be a separate staff, a full separate staff, right, that is trained and qualified to give that therapeutic support to the thing. We don't get the funding for that. We get a lot of
And so when they gave them the funding to purchase the vehicles, they didn't give them funding for staffing and all that comes with the mobile units.
Now I know what we get, Tara. We get a driver, right? We get a person to kind of work with alongside, but there's no real money to fulfill the magnitude of demand for the vehicles. The vehicles are in tremendous demand. And so for us, we do a lot of other grants for our therapeutic work and for the Peacemobile.
Councilmember Williams, do you have any questions?
I did. I gotta go get my phone. Sorry.
Where's her phone?
I was charging it.
Oh.
I have a portable charger if you want one.
What is my constituent saying about me?
No, I was just saying that I have a portable charger if you want to use it.
Okay. What would it mean for your community if your CMS site received full funding to cover all aspects of the ecosystem beyond just street intervention?
So if we were able to receive, it would definitely mean that we would be effective. We would be able to run an effective operation 24 hours a day, 7 days a week. We will be able to really be the ecosystem that addresses, as Councilwoman Althea just raised, being able to show up all times when people need the services, not an after effect or afterthought. We would look and be as professional as all of those other city first responders who respond to situations. We would able to have health insurance that really deals with the magnitude of what our people need. We would have life insurance. We would have equipment that protects us, because we have several employees that have been shot, stabbed on the job, and they don't get some of the, they don't get no health insurance to deal with the after effect of them being shot. Right? There's no extra money. Some of them might have even lost their jobs because they can't perform to the, and there's no line of duty support for them. There's no hundreds of people lined up. So it would allow us to really be an effective system.
So I just have a question, because I know that's often brought up. Are you guys looking, or would the ideal situation be to become a city agency? Because some of the things that are even being asked are things because they are actual city workers, and these are contracts that are being contracted out, and we know that they don't treat human service workers the same, which is why they contract it out, because it saves the city money. And so is that something that you guys are looking, or is that something that's being advocated for? No. Because those two things are very different.
So we don't want to be a city agency, but we want the benefits that city agencies have. We want the cake and we want to eat it too, because we're different than most nonprofits, right? There's nonprofits that are not running, like we're literally standing between a gun, a trigger, and another person, talking them off that ledge. And sometimes we've been the victim of those things. There's no other, I don't know of another agency that is putting their life on the line the way we're doing. And so we're asking, I remember with the community in Crown Heights, where they received bulletproof vests, they received cars, they received a level of communication and coordination with NYPD that we don't receive, right? And so we're asking to be respected.
I know what you're talking about.
Thank you.
Hey, me too. Okay, last question. Can you speak to how collaboration with city agencies has or has not helped you to co-produce, I know that was the word you used, public safety in your neighborhood? And I know I mentioned it before, And in conversations, I want to do more like digging and research. And I know you know pretty much everybody across the country doing stuff in this space. But one of the things that struck me about Newark's program is that it's so integrated. Like, it's a level of respect because of the mayor, how the mayor has integrated, and they're not called CMS, but for all intents and purposes, their CMS program into the day-to-day functions. Like, their CMS person gets an alert the same time the police commissioner gets an alert, and then
And the
that
same thing in
information.
St. Louis when we went to St. Louis.
Yeah,
it's the
same thing.
thing.
And then to the point about like funding for all of these wraparound services, it just seems so much more coordinated. And as a person who has sat on a board of a crisis management organization, I think that the disjointed nature of the system itself has always troubled me. And then the lack of true integration, seamless integration, which is a tall task because city agencies sometimes don't integrate with themselves, which is another
Correct.
discussion. So yes, if you can just talk about like how has the integration, lack of integration, helped or harmed the work that you're doing to provide public safety?
Well, it starts with the fact that we have been transitioned from city agency to city agency to city agency in our lifetime. I mean, we are a public health approach to the gun violence epidemic, so of course we landed in the Department of Health and Mental Hygiene, which made sense. Next thing you know, you move us to the Mayor's Office of Criminal Justice, and I could see the correlation between what it is that we do and criminal justice, right? And now we're on the Department of Youth and Community Development. Well, the population we primarily serve are youth. So if you could take all three and turn that into one city agency, then you'd have a perfect world. In terms of integration, Dr. Ford mentioned the police department, she mentioned the FDNY. Well, we're stopping bullets and we're putting out fires on a regular basis, but we're not treated the same. We're not giving the same economics, we're not giving the same tools, the same equipment, the same latitude, the same information. So what this would look like if it was fully integrated is you would probably have the most powerful workforce you have ever seen. That also includes the reduction of the use of police for every single issue that happens in our community. They really don't have any knowledge of how to deal with in the first place because they're not from there. So the credible messenger workforce, be prepared, because if you really invest in this, you're gonna see vibrant, healthy communities unlike what you've ever seen before. We know because we've been doing it for over a decade. Just come by and visit.
So the model came from the FEMA model, right? Response, recovery, mitigation, prevention, right? And so each system, so just like a disaster, right? Every shooting, we should have all those agencies on the scene, right? And so, because sometimes people need to be moved immediately. So we need to find housing someplace else. We need housing. We don't have time to chase down the people in housing. Oh, who are you? No, I don't know who you are. No, you know, we don't have time for that, right? We got to move somebody right now. And I literally had to go and snatch somebody out of their house. 10 seconds later, here comes the gunman to shoot up their house. Right, and we had to take our money and take them to Long Island and put them in a hotel, and it was a risk, right? It was a risk, and of course, because they're high risk, undisciplined, they got kicked out the hotel. We have to move them to another one, right? And so all of this coordination can be done seamlessly with city agencies. The garbage, right? Garbage where they hide guns, right? If we could clean up, if we could get lights in real time, real time. Right? Those things can happen more effectively with a stronger coordination and respect. When you talk about Newark and all of the other cities that came after us that we helped to build, right? It's always better the second time around, right? And so the level of respect from this city to us didn't happen in the beginning. NYPD couldn't stand us, right? And we couldn't stand NYPD. And so you had a friction of marriage that wasn't and still isn't at its core the best way, right? Most of the city council people don't know what CMS does. They just look at it as those violence interrupters, those criminals, those perps, right? There's so many different names that are given, and so and then even the hospital, right? It might look good now, but we literally had to fight with those people to go into the hospital to provide the services to the folks, and we became the enemy. So, I think the integration of the parks turn off the lights at 9:00 at night, right in the middle of a basketball game, creating the most unsafe environment for our community, right? Just because they can. They have no connection to what it is we're doing, but they have the ability to make a decision that impacts our community in a second. They could do it or they can't, right? The guy literally sits at home and turns it on or turns it off, right? And so the decision making has to be one that is people sitting down at a table and first knowing that we all are equally important, and then we're talking to commissioners, right? And not every level of our organization is talking to the commissioner, but we're talking head to head. And the head gives the directions down, and it goes back up, and it goes down, and it's really integrated in their system of work and approach.
Well, I feel like I had a missed opportunity. I actually probably should have had you guys go before.
Yes. Yes.
So I apologize and that's why we're taking up so much time, because if you come to our hearings, y'all know I'll be cutting everybody off. But I think that it's important that the information that you guys are sharing is on the record, and that we in this part of the conversation, because I think it is a huge disconnect. And I'm not just saying it in DYCD, and a lot of agencies where what's happening on the ground or the intentions of things aren't necessarily being played out in real time. And so, again, CMS and Cure Violence and all this work has a very special place in my heart. I know Councilmember Williams and Councilmember Riley, we've been really trying to push this conversation forward. Since we got here, this has been one of the first things that we were trying to take on, and it has been, it's one of the Hood Caucus priorities. Yes, I'll say it for the record. It has been a priority, and it has been very hard to get information. I will say DYCD actually has been more forthcoming than it was when it was under MOCJ, but we have so much further to come. So again, I want to apologize, because you guys actually should have went before the panel, because I think it would have set a different tone around the direction of even questioning and even what folks could have said, because I do think that the partnership isn't as seamless as it needs to be. And you guys are the experts in the room. You guys have been here since the start of it. And so when it changed from agencies, you guys should have been part of those conversations in those transitions and understanding it. And I told Cliff, you guys actually all are cheering him on, but we still are not going to not hold him accountable. So
I know.
That's
but
my
that's
job.
not Cliff is an employee.
All of them are employees.
I know, but they're,
No, listen, I love my agency, and Natasha will tell you, I'm very protective of them. But when everybody sits at that dais, they get the smoke.
Yes.
So that's how I do. But thank you guys so much for being here, and we appreciate all the work that you guys are doing. Thank you. So the next panel, Sophia, Cheyenne, Tyra, and Jackie.
See you tomorrow, Councilman.
Oh yeah, you guys are coming?
Good afternoon. Thank you, Chair Stevens and members of the committee. For the record, my name is Sophie Fashana, and I work at Next 100, which is a progressive think tank that centers lived expertise in those proximate to the issue as in the driving policy chair. I'm here today to express my support for the Prevention of Luggage to Foster Youth Bill, led by Council Member Rita Joseph. I came today to speak as an advocate, but also as an alumni of the foster care system. We are here today because every day in New York City, a child enters the foster system carrying everything they own in a black plastic bag, conveying that they are disposable. The journey through the foster care system in New York City is unstable and disruptive for thousands of children, and the data reflects that. According to data analysis by Children's Rights, children in New York City foster system transition on average about 3 times. For some, this means 3 different schools, 3 different families, and 3 different environments. Within this already stressful transition, the simple act of providing a child with dignified piece of luggage to carry their belongings is not common practice, despite the over 22,000 transitions occurring within the city. Let me start with my own story. When I was first handed a large black trash bag by a caseworker, I did not speak English, but I got the message. I and everything I held dear was trash. Sadly, my story is not original. I've spoken with countless young people in New York City foster system who feel this similarly, like Jalen, 21, who, when navigating New York City's foster system, had the word worthless echo through her mind. The trash bag felt to her like confirmation of that worthlessness. Destiny belongings got mixed up in the trash and thrown into a New York City garbage truck multiple times during moves. Imagine everything you own, that you possess so close to your heart, being thrown in a trash bag because it's confused by the bag that was put in. The agency told another child moving with trash bags to shut the F up and deal with it. In 2023, a statewide policy program called My Bag distributed 3,560 duffel bags to local Department of Social Service across the state, serving only a quarter of children who need them. New York City received none, despite being home to over half of the foster population. In October, Councilmember Rita Joseph introduced the Luggage to Foster Care Youth Bill, a well-funded and enforceable citywide policy mandating adequate luggage for all children in New York City foster system. Just a few weeks ago, a similar bill passed anonymously in both the New York City Senate and Assembly, led by Senator Brisport and Assemblymember Hevesi. Now we're asking for your leadership in passing this bill at the city level, but also urging our Governor Hochul to take the next step in ensuring that young people in foster care are provided with proper luggage, and to sign Senate Bill 3781. Today, I urge you to exercise your leadership to pass the city bill and advance it to the Speaker, as well as issue a letter of support urging the Governor to sign the state bill into law. I will leave you with this. Ironically, with the city takes steps in banning unsightly black trash bags from our streets, we still allow our children to carry their belongings in those very same bags. If we care about the image of our city, we must care even more about the dignity of our children. And as the chair, you said, you want things that make sense when it comes to policy. This is a policy that makes sense. It's a policy that's direct, and it's a policy that serves our children and the future of this country. Thank you.
Hi, council members. Good afternoon. My name is Cheyenne, and I'm a policy advocate at a think tank called Next 100. And I have had lived experience in the foster care system since I was 15 years old. Thanks, Sophie. I wanted to start by saying how deeply grateful I am that this council is prioritizing the collection of more data on where youth aging out of foster care is placed. And I'm 100% in favor of this step forward. As someone who was placed in supportive housing myself and who has spent the past 2 years researching the conditions of those placements, I cannot emphasize enough how important it is to not just count those placements, but to understand the environments behind them and how they affect the youth who live in them, who are just beginning their lives. Tracking this data means we're finally paying attention. It means the experiences of youth like me are no longer invisible, and it opens the door to real accountability and real change. In my upcoming report that I worked on is called Where They Live. I mapped more than 175 supportive housing sites across New York City that serve former foster youth. And I compared those locations to indicators like violent crime, building violations, racial segregation, and poverty. And the pattern that emerged were definitely heartbreaking, but definitely not surprising. Youth are overwhelmingly placed in neighborhoods with the highest level of concentrated disadvantage, areas with aging buildings, unsafe streets, and with few opportunities to heal or grow. So according to the Opportunity Atlas and New York NYPD data, over 1/3 of the buildings I analyzed are in neighborhoods where poverty exceeds 30%, with some that are high as 52%. These buildings have an average of 63 violations each, with some over 200. And in the surrounding precincts, youth face exposure to high levels of violence. Median annual rates of 19 rapes, 178 robberies, and nearly 300 felony assaults. These are not just numbers. These are neighborhoods where young people are often being placed with no family, little support and just little say in the matter. And right now, while we track how many young people are placed, they're not being tracked whether they're safe or whether their housing is viable or whether their placement supports their future. That's why, in addition to supporting this bill, which I'm really thankful for, I recommend the following things to strengthen it. First, collect neighborhood level indicators alongside with placement data like crime rates, building violations, and poverty level, because these contexts really matter. Without it, we risk overlooking deeper patterns that are hurting these young people. And second, please, please, please require ACS to publish an annual report that gives a full picture, not just where these youth are placed, but how those placements are working. The report should include the census tract, the physical locations of all the supportive housing where former foster youth live, for each building, maintenance compliant data like number and nature and resolution time, inspection results, and the trends by housing providers, youth satisfaction and feedback surveys, in the midpoint and exit and when they enter these buildings, the outcomes like education, employment, and income, and housing stability after these placements. This level of transparency isn't just helpful, it's essential. It's how we begin to ensure that young people aging out of care aren't just placed, but supported, not hidden away in disinvested neighborhoods, but placed where they have a real chance to heal, grow, and thrive. That was one of the testimonies that I wrote, but I also came to testimony for Sophie's luggage bill, the one with Rita Joseph. So I'll just read that really, really quickly. Can I or no?
No, could you submit it for, you can
Yes,
submit
yes,
it for
yes.
testimony.
100%, I can.
And also ACS wasn't here today, so
I
we
know.
would actually need it so that we can give it to them. So if you submit it, that actually would work for us.
Okay, that sounds good.
Thank you.
Is this on? Yeah, okay. Hi, my name is Jackie Gazdighian. I'm a supervising policy attorney at Brooklyn Defender Services, and I've been a public defender for 15 years. BDS commends the council and Chair Stevens and Councilmember Williams for recognizing the importance of community investment and crisis management as part of the solution to prevent and reduce violence. We have witnessed the power of credible messengers who are trusted community leaders to build rapport, meet young people where they are, and de-escalate conflict. We urge the city to expand the catchment areas and bring in additional leaders and neighborhoods into the CMS system. And when it works best, the young people who interface with CMS credible messengers or violence interrupters do not need our services because they are able to avoid contact with NYPD and the legal system. And while the crisis management system is a critical part of ending violence in this city, the city must also focus on what happens if someone actually gets arrested. The fact is that even with CMS, arrests are still happening, and instead of getting the services and programming that young people in this city need, they are facing incarceration and prison sentences. BDS is fortunate to have great relationships with several alternative to incarceration programs, Fortune, Exalt, Osborne, Bronx Connect, Good Shepherd, just to name a few, and they provide many of our adolescent clients with holistic services. But for our clients facing charges of alleged gun possession, harsh mandatory minimum sentencing guidelines, which are 3.5 to 15 years in prison for possession alone, make resolving a young person's criminal case with an ATI largely dependent on the consent of the district attorney's office. There is really no clear criteria used to determine eligibility for ATI programming, and the process for acceptance is almost unilaterally controlled by the DA. This is why we must also look at how emerging adults are being treated within the criminal legal system. We now know that while an 18-year-old may be a legal adult, their brain is not fully developed until their mid-20s, and even if a young person at age 16 or 17 has access to programming and services in family court, as a result of New York's Raise the Age law, once they turn 19, they are subjected to these mandatory minimum sentencing guidelines. The science shows us that emerging adults, like younger adolescents, are remarkably malleable and still developing impulse control and the ability to anticipate consequences of choices. We ask the council to support and pass a resolution urging the enactment of the Youth Justice and Opportunities Act, which would expand opportunities for programs and other alternatives to incarceration and immediate record sealing for young people up to the age of 25. We have additional recommendations in our written testimony, and we thank the City Council for holding this important hearing today and your commitment to violence prevention through community investment. Thank you.
It is not limited to de-escalation of conflicts that occur anywhere on the street as our staff come to work or they leave work. I want to include that the work includes mentoring. It includes at times parenting. It includes feeding people in the community. It includes housing. It includes assisting not only participants who come willingly, but community members with assistance in reentry, helping to reenter youth in school, helping youth with mental health therapy. This part is so important because after they connect with credible therapeutic staff, quite often they don't want to be referred on to individuals that they don't know and who are not sensitive to their plight. The work of the crisis management system includes safe passages contracts, but also assistance with safe passages where there is no contract for the crisis management system work. It includes assisting parents in navigating hospital visits with high-risk youth. It includes managing the flow. I'll wrap up here. It includes assisting hospitals. It includes assisting parents and advising them on hospital visitation when their youth might be considered high risk and there are people coming in and out. It includes cleaning up garbage within our neighborhood. It includes beautification of a neighborhood. It includes assisting a youth in not committing suicide, and it also includes in those not so pretty places without bulletproof vests, with only 4 violence interrupters per site. It also includes us speaking to youth, us getting youth to come down off the ledge when they're talking about resolving a problem with the use of a gun. Our work is varied, our work is deep, and I'm sure many would attest that I did not even scratch the surface of the work that the crisis management system does in New York City, that which is done within the 8 hours, that which we do as we try to stretch how can we best service our community, the families and the youth that volunteer themselves for Change Life. I'll end here, but we really probably only got 25% of a view of who we are as part of the crisis management system and the work that gets done.
Thank you. Councilmember Williams, she has questions.
Yeah, and I'll be very brief. If you could, can you email me your testimony? Because I just have questions. We have been talking about the budget, and something you said triggered my brain around certain things that are up to the DA's discretion around like Project Reset or other diversion programs. I would just love to work with you and talk to you more about that. Thank
Definitely.
you. No questions.
Oh, that'll be all for this panel. Thank you.
Chairperson Althea, it's been noted that there has been a mayoral increase, 50% advancement of payment of $136 million increase in monies to the crisis management system.
I'll like that word advancement because they literally giving you money for work that you already did. So
prior to.
We used to get 25% advance.
I know.
Now we get.
I'm not giving them points.
They tried.
You said
that was cute though. They was like, hey guys, they did. No. All right.
Alome Gin.
Rachel.
Okay, hello, my name is Christopher Leon Johnson. So I want to say first off here, free Brad Lander. Brad Lander has been arrested. He's in current ICE detention. I know it's kind of off topic.
No, you know I gotta say it.
I need to free Brad Lander. I'm going out there after this. Free Brad Lander. So I want to make this clear that I'm calling on the next mayor administration to fire A.T. Mitchell as the gun violence prevention czar, because he has done nothing as the gun violence prevention czar in his tenure as mayor. It's completely came as a useless position in the mayor's office, and I'm calling on the next mayor to fire him and replace him with Rebecca Fisher of New York Against Gun Violence, because I think she has more brains than he does. So we need to get rid of him. I'm calling on this city council to investigate these cure violence nonprofits, because I see that they've done nothing for these districts at all. They've been calling for the defunding of ShotSpotter. This is nothing but a vote harvesting scheme done by these nonprofit CEOs to just allocate votes, while violence is never reduced in the districts at all. I live in a high crime district, the highest crime district in New York City, which is the 41st district, and these cure violence organizations have done nothing to really mitigate the crime in the district. The only people that mitigate the crime in the district is the NYPD. So I'm calling on the city council to defund these cure violence organizations and give it back to the NYPD, and make sure we say ShotSpotter contracts. So that's what we need to start doing. ShotSpotter really saves more lives than cure violence organizations. And this is what it is in 2025. So like I said, I'm calling the city council to really investigate all these cure violence nonprofits for 2020, for this year and next year. And like I said before, I have 15 seconds left. Free Brad Lander, free Brad Lander, free Brad Lander, free Brad Lander. I'm just summing it up, 5 seconds. Free Brad Lander, free Brad Lander,
Chris,
free
stay
Brad
on
Lander.
topic.
Free Brad Lander.
Thank you.
Free Brad Lander.
Thank you. Thank you.
Thank you.
Thank you. Have a good one.
Well, thank you very much. Thank you for the opportunity, Council. I'm Ms. Takesha Newton. I'm the lead community organizer in the Community Justice Unit at the Legal Aid Society. And I'm sorry, I have to go with my heart right now behind the statement that was just made in reference to defunding any cure violence site here in New York City. We actually need to give more funds to our cure violence sites throughout New York City, because we have been the change that our communities need and making our communities safer. And I am a prime example of that. I previously worked in cure violence, 696 Bill Queensbridge, on the early days on with leadership from Kay Bain and Erica Ford, and I am now over at the Legal Aid Society. And so I know what our communities need. I know what the cure violence sites need in order to create a safer environment for our youth and our elders throughout our communities. I heard you speak about shooting responses, and I just wanted to tell you a little bit about the cure violence and how important that is in the mediation process. If you have harm going on in your community and you don't take a stance with your community to show them that you are not for further harming your community, it shows a powerful notion of solidarity to the people who are still stuck in their state of trauma. And we need to understand that for all of us, this is a healing process from the trauma that we experience growing up in our lives and what we are continuing to face now on here. I wanted to speak about CJU's funding that has been cut, and how, although our funding has been cut, we, the staff in the Community Justice Unit and the Legal Aid Society as a whole, has continued to provide all legal entities and services that we can, because we know, although we cannot physically stop someone from harming someone with a gun, we know that if we are able to help them with those other amenities in their lives that is causing them further trauma, that is a way of us showing the community that we care and we are here, and we're not here to just talk about what we want to do. We're showing you by proof of example that we are here to assist you and your communities with some of the circumstances that you are currently facing. And I know that I went over my time. Thank you very much.
Everybody went over their time today. It's okay. I told you I have to. Yeah, I am, because I'm usually that part. Thank you, Annie, because you know. No, a lot of folks left, and I did want to make sure that we heard the whole story, right? And I think it was important, especially with our first panel with Bragg and Life Camp, to be able to kind of give more of a historical perspective around it. But thank you for coming. I do want to respond. I know you said about the shooter response. I have to respectfully decline and respectfully say that I do not agree with us continuously putting our trauma out on Front Street and being the story that's being told about our communities. Because whether we like it or not, yes, we want to stand with our community, and I think there's ways for us to stand in our community in those moments, but it does not have to be on the news. It does not have to be crying mothers. It does not have to be the perpetual cycle of trauma that's being displayed. And so there needs to be a balance of what that looks like and what we keep displaying, because guess what? I have events in my district all the time where young people are doing extraordinary things. Nobody shows up. But as soon as there's a shooting, we got 7, 4, 12, everybody's out there to exploit our community. So we as a people have to figure out how to make sure that there's a balance and there's a way for us to show up and support our community members and not put our trauma on display. So I have to respectfully disagree with your statements. So.
Yeah, just a quick thing that I think my issue with shooting responses, and I feel like Erica probably knows my opinions about this, is that I think when you're talking about how to, in the world of quantifying success and data, my issue is, Erica made a good example about like a shooting response should not just be people pretty much rallying. It should be people providing services. So like showing up to a shooting response, what are you actually doing there? And I think it's the nature of some of the shooting responses that I've seen more lately. And this idea of how can you quantify that is leading to a reduction in violence? And that connection to me is lost. So I just want to add, because I have my issues with shooting responses, but not based off of what you said, just based off of what I see and what doesn't take place, which is this sort of wraparound effort that isn't just somebody got shot here. It's like, no, what else are we doing? How are we going into the community to ensure that we are truly touching people and able to reduce violence?
So I wholeheartedly agree with that. Re-traumatization is very real. And when I lost my husband to gun violence in 2006, right, I didn't have my community that I have now to wrap their arms around me and support, right? What I had was the NYPD pointing the finger at me, right, and preventing me from getting funeral assistance for my husband. My children didn't, receive, any mental health services, right? No one to speak to. So these are the things that we need, and those things should not be prevented from us just because we're affected by gun violence.
So I have a question. And I'm happy you brought that up. Well, not happy. I'm sorry for your loss, and I want to send love and light to you, because that is a traumatic situation. But there has been some pushback, even when we brought that up to the administration, that families who've been affected by gun violence being denied services. So I just want to have it on record. Is that you just said that you experienced that. Can you tell us a little bit about that experience? Because I was literally told by the mayor's office that is not true, that is not happening, and that everyone has access to this. So could you just talk a little bit about, if you mind, if it's okay?
I don't mind at all, and it is an actual fact that happens. My husband was labeled a gang member just because he was shot. And just because you are harmed by gun violence does not mean that you are a gang member, and no one should be labeled as such. So where is the humanity for my children who weren't even teenagers when they lost their dad and received no assistance and no help at all? And I'll say it here because I'm being truthful and honest. The 114th Precinct in Long Island City actually contacted social services and told them to not assist me because I wasn't being in compliance with them.
So the precinct contacted them and started that. Okay.
Yes.
No, this is and this is helpful information because this is one of the things that we did give pushback on, and the administration swears that that is not happening, that you cannot be blocked services, and they tried to put it on the providers and say that it was them who was not willing to do the outreach. And when I gave pushback, they kept saying, like, you don't have any clear examples. So I would love to continue this conversation because this is definitely something that we brought up and they consistently say is a non-factor. Which
Well,
is
it is
really
a
upsetting.
fact.
I know it is, but you know, it's what. Okay, absolutely. So we'll connect afterwards. So because that was one of the conversations I had, and they made it seem like I was crazy, and I was just like, no, I've heard this and I've heard this on my side in the Bronx, where families said that they were denied victim services because they were known gang members. And it was kind of connected to my gang database bill, but we'll talk about that offline. But thank you guys so much.
Yes, thank you.
And thank you for your time.
Thank you. I just want to do a last call, make sure everyone who filled out a slip was able to testify. Okay, so that concludes the in-person portion of our public testimony, and we'll now move to remote testimony. If you're testifying remotely, please listen for your name to be called. Once your name is called, a member of our staff will unmute you. You may then start your testimony once the sergeant at arms sets the clock and cues you to begin. Our first panelist will be Omar Jackson.
You may begin.
Chair Stevens, for allowing me this opportunity to testify. My name is Omar Jackson. I'm one of the fearless leaders in the crisis management system. I represent Stand Against Violence East Harlem, as I'm the director of that organization. And our parent organization is GOSO, Getting Out, Staying Out. I have over 10 years, well over 10 years in this field of work. At SAVE, it's one of the crisis management organizations, so you're very familiar with the work we do at GOSO. They provide our wraparound services where we focus mainly on the 3 E's, which is education, employment, and emotional well-being. And I know I may sound a bit redundant because my colleagues spoke so eloquently about the crisis management system already, but I just want to not only speak to the amazing work that we do on the ground, in the juvenile detention centers, in the hospitals, in the schools, but I kind of want to speak about our baseline process. And, you know, I feel as if we don't, not only not getting paid enough, but sometimes we don't get paid at all, right? Especially the smaller organizations. So ensuring sustainability through baseline funding is very important for the crisis management system. As CMS consistently makes measurable impacts in communities such as East Harlem, you know, through crisis response, through mentorship, through violence intervention and prevention, we all face that challenge of sustainability. And in order for us to continue to do this life-saving work effectively, we have to have a consistent and dependable funding stream that gets us our funding on time. There's so many times in organizations such as myself, we have cash flow issues, and there's some times when I know that other organizations aren't able to pay their staff for a certain amount of time.
Thank you for your testimony. Your time has expired.
Excuse me?
Thank you for your testimony. Your time has expired.
Okay, thank you.
Thank you for your testimony. Our next panelist is Jan Heimlich.
You may begin.
If there's anyone else on Zoom who wants to testify, please raise your hand. If there's no one else, I'll turn it back to the chair for closing statements.
I would like to thank everyone who was here today, DYCD for showing up, all of our advocates and those who are still in the room. Thank you for your work and your service. But as we have discovered today, there's so much more work to be done, and I look forward to working in partnership with you all. Thank you.